Good morning, everyone. Heidi Flores from Lewis for the record. We are just going to give it another minute or two, and then we will get started. Thank you.
All right, good morning, everyone. For the record, my name is Erica McAllister, and I am the School Health Services Liaison for Nevada Health Authority and a BAC and BAC support staff member with the Community and Provider Engagement Team. On behalf of the Nevada Medicaid Beneficiary Advisory Council, I would like to call the meeting to order and verify that this meeting is being recorded. Thank you. Today's meeting agenda for the Beneficiary Advisory Council was posted on July 11th and revised on August 5th, 2025 on dhcfp.nv.gov and at notice.nv.gov. And just a few quick housekeeping items. If any in-person folks need to use a restroom, it's just going to be up the door to the left and make a right, and then it's straight ahead. And we can assist you with finding it too. It's kind of a maze in here. And then in the case of an emergency, the emergency exit closest to us is going to be those front doors that you came in through. And next, I will pass it off to Jonathan.
Hi, good morning, everyone. My name is Jonathan Figueroa, and I am Community Engagement Specialist. I'm a MAC support staff member. I'm gonna go ahead and go through a roll call to confirm if we met quorum or not. When you hear your name, please respond here or present, just to confirm your attendance. Bill Sims.
Here.
Azraela Gravel.
Here.
Grace Larkins.
Here.
Hilani Queen.
Here.
Ann Jensen.
Here.
Brooke Blanco.
Brooke, I see that you're online. You may need to unmute.
Me? Here, sorry. I figured it out.
Thank you, everyone. Quorum has been met. Now moving on to public comment. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. Comments will be limited to 3 minutes per person. Person making comment will be asked to begin by stating their name for the record and to spell their last name and provide mschiffer@nvha.nv.gov with the written comments. Comments must be provided up to and including the day of the meeting by 5 p.m. for inclusion on the record. If you would like to provide public comment, please raise your hand in the Teams app or type public comment in the chat along with your name so you can be called on to begin. If you are joining the meeting by phone, you can raise your hand by pressing *5 on your keypad. When we call on you, we will identify you by the last 4 digits of your phone number. When you are called on, please state your first and last name at the beginning for recording purposes. You will have 3 minutes to speak. And then moving on to agenda item number 4 for council member introductions. When I call your name, please say a few words about yourself as a means of introductions to other council members. Bill Sims.
Hi, Bill Sims. I'm a native Nevadan for about 20 years total. And the thing I like to tell about myself that most people find very shocking is that over the course of my life, I have been hit by a vehicle on 6 different occasions.
Oh my gosh.
Yeah.
Wow.
5 of them on the bike. So,
Thank you, Bill. Azriela Gravel.
Hi, I'm Azraella Gravel, and I am a Medicaid participant. I have 3 wonderful children, and I currently am going to UNR for pre-med, hopefully becoming a doctor in preventive medicine.
Grace Larkins.
Hi, I'm Grace Larkins. I have a daughter who's 10 and a half years old with complex medical needs, and she is a recipient of the Katie Beckett eligibility option. So she is a Medicaid beneficiary. And so I, as her parent, I also work at the Nevada Center for Excellence in Disabilities in the Family Navigation Network. So I just provide supports for other families who also have kids with disabilities.
Kaylani Queen.
Hello, my name is Kaylani Queen. I have been in Las Vegas since 1999. I am a single mom of 2 and a Medicaid recipient. I'm also a Medicaid doula here in the Las Vegas Valley as well.
Brooke Blanco.
Hi, my name is Brooke Blanco. I'm born and raised in Las Vegas. My mom is white and my dad is Cuban. I have 3 boys. I'm a Medicaid recipient as well, but my last son, I actually had preeclampsia, which turned into eclampsia. So he came out at 5 months and wasn't even close to being done cooking, but he came out all right. So.
Great. Thank you, everyone, for all those introductions. I want to pass it off to our Medicaid Administrator Ann Jensen.
Awesome. It's nice to meet you all. My name is Ann. I'm our Medicaid director here at Nevada Medicaid. I'm newer to this role. As you guys probably know, we made some changes within our health authority this July, which is really exciting. So I stepped into this role in July, but I've been at the state for just about a year. I joined to lead our children's behavioral health transformation. So I've been working really closely on our efforts to try to improve what we do to support kids with mental health needs through more services at home and in their community. So I'm really excited to meet you all. I'm just really appreciative that you're taking the time to be here. I know you have very busy schedules and a lot of family obligations as well. So I really appreciate, again, you being here and sharing your perspective. I want to thank our team also, who's been working very hard to prepare for this. I think this is, as you all know, the first time we're doing it, and we really look forward to your feedback. But we take this very seriously and are very eager to use your feedback in everything that we're doing. So I want you to know that this is the meeting I've been most looking forward to all week, and I'm really excited to be here and look forward to learning from you all. So I thought it would be helpful to start out with a little bit of a summary on what is Medicaid. I think as you all have probably experienced, the words that we use and the way we talk about it is a little bit confusing at times. And so we wanted to start with a little bit of a summary on what are we talking about here? What does Medicaid mean? What does it look like in Nevada? What does it look like across the US? And answer any questions you guys have on what we're doing here. So please feel free to interrupt me anytime. Happy to explain more or go deeper or explain a word. I'm trying really hard not to use any acronyms or funny words, but if you're ever like, Ann, what words are you saying? Just stop me and I'm happy to talk about it. Sound good? So if you want to move to the next slide. Thank you so much, Erica. What is Medicaid overall? And would you be willing to present just so we can see it bigger on the screen, if that's possible? Sorry, I don't have my glasses on, so I want to make sure I can read it. Yeah. Perfect. We'll cross our fingers. I see it coming up. Yeah, thank you so much, Erica. I appreciate it. Okay, so overall, Medicaid is a program that was established in 1965. So we actually celebrated Medicaid's 60th birthday 2 weeks ago, which was very exciting. So it was established by President Lyndon B. Johnson as part of a lot of other federal initiatives to provide more healthcare. And it was really focused on moms and people with disabilities at first. And through time, it's really evolved and morphed into what it is today. So when we have that slide up, which I see down at the bottom, so I know it's coming, we'll share a little bit more about what that means. But overall, Medicaid is a partnership between the federal government and the states to provide health insurance that's low or no cost to recipients. Let's see if it will
Sorry, give us 1 second. We're
You're
having
good.
some
I want to make sure, yeah, folks online are able to see.
So if we can see it online, just so you guys.
Oh, I see. Oh, is the, oh yeah. Maybe on the little touchpad, yeah.
It's on content.
There.
Yeah. Okay, cool. Thank you guys. I appreciate it. So state federal partnership, as I mentioned, 1965. Those Roman numerals there are Title 19 of the Social Security Act is the kind of backbone, the legal backbone of how and where Medicaid exists. So if you ever want to read it, it's very juicy, it's very exciting. But Title 19 is where it lives within our federal law. As I mentioned, so it's a combination of federal money and state money. We'll talk more about what that looks like. But through those federal requirements, every state is required to cover a minimum base set of benefits. And when we say benefits, we mean medical or behavioral health or pharmacy or dental services that Medicaid money will pay a doctor to deliver or another provider to deliver to a Medicaid recipient. So there's some things that we're required to do. There's others that are optional that Nevada has selected to do. And there's a lot of different rules that govern what that looks like. So we're going to go through what Nevada's specific program looks like so you can learn a little bit more. But I think it's important to know what Nevada Medicaid looks like. Once you've seen one Medicaid program, you've seen one Medicaid program. Every state has a very different model. And so we want you all to be a little bit more familiar about the choices that our Nevada legislature and governor has made over the years to make the program what it is today. So if you move to the next slide, this I think is a really helpful summary by the numbers of what Nevada Medicaid looks like right now. So on this map on the right, you'll see darker blue is where there are more Medicaid recipients based on the map of all of our counties. So you'll see about 70% of our Medicaid members live in Clark County. 78%, excuse me. So majority of folks live in Clark County, and we're super appreciative of our BAC members that are joining us virtually. I'm excited to meet you all when we're in Vegas coming up. But we have, as you see, members across our full state. So it's really crucial for us to develop a program that works, not just in Clark or not just in Reno or Carson, but for recipients across each and every one of our counties as well. In total right now, 1 in 3 people in Nevada receive coverage through Nevada Medicaid. That's about 800,000 people. And that has grown pretty significantly since COVID. So the way that our kind of eligibility has shifted over time has meant that we have a lot more folks joining our program. That's kind of stabilized in the year since, but we're right around 800,000. With the money from the federal government and the state money combined, every year we pay out $5 billion in services. So it's a lot of money going out the door. 1 in 2 babies born in Nevada are covered by Nevada Medicaid. So you'll see it's a much higher percentage than overall. And we'll talk a little bit more about what managed care looks like, but the majority of people in our state right now get coverage through a health insurer that receives money from us to deliver that care. So we'll talk about that a little bit more soon. So I think you'll see there's a lot of good numbers here. Any questions though on the kind of high level summary of what our Medicaid population looks like right now? Okay, cool. Let's keep moving to the next slide. So as we mentioned, who pays for this, right? There's $5 billion going out the door. Whose $5 billion is that? And the answer is it's a combination of the federal government funded through taxes and the state share, which is part of the general fund is what it's called in Nevada. So the amount that those blue and green bubbles represent varies depending on the person that's receiving the care. So in Nevada, typically that blue federal share is about 60% of every dollar. So 60 cents of every dollar comes from the federal government, 40 cents of every dollar comes from Nevada. That looks a little bit different depending on the person. So there's different categories of Medicaid patients that have maybe higher federal share or higher state share, but on average, it's about 60% of federal funds, 40% of state. And what's really important there is if we're getting any federal money, we have to follow the federal rules, right? They won't give us those 60 cents unless everything we're doing aligns with federal law. So that is why you'll hear a lot of discussion on how does this align with the Social Security Act and other federal rules? Because if we don't follow those, that blue bubble goes away entirely and Nevada has to pay for that full service on their own, which as we know is we don't have $5 billion to spend, right? It's crucial that we get that federal money too. So if you move to the next slide, This is a fun slide that Stacey Weeks, our former administrator, and now she's our director, made, which I think is a good one. But she really describes the state Medicaid program as a special flower. So the foundation of that flower pot, is the federal regulation. So Title 19 of the Social Security Act, that is consistent. That pot looks the same for every single state and all 6 territories that have Medicaid. The stem is really the contract between the federal government and the state. And that is something that we have to get approval from the government. That's called a state plan. We'll talk about these words a little bit more. But that really allows us to develop the Nevada specific program. So there's the federal requirements, the Nevada program, and then we water that stem, that growing plant, with whatever choices we want to make in the state. We add optional benefits. Our legislature wants to add a new service or a new provider that receives funding through Medicaid. And that makes it very unique. And so the flower, the final result, is a Medicaid program that's reflected in our policy and in our contracts that's very specific to Nevada itself, but within the realm of the federal program. So does that kind of overall make sense in terms of how it's designed? Cool. Let's keep moving to the next slide. Oh, and my flower is growing. I forgot that. That's so cute. That's great. That's great. So I think there's a couple really important questions that we need to ask ourselves in the realm of Medicaid. The first one is, how is care delivered to patients? And what we mean by that is, when you go to the doctor's office, whose name is on the insurance card that you give to the doctor, right? Who is the kind of intermediary that's paying for the service? And right now that looks like 2 different models. One is what we call fee for service, and that is a state-run program. So the name on your insurance card for the fee for service program is Nevada Medicaid, or DHCFP, our previous acronym, right? So the state directly pays the providers for the service that they use. The state decides how much we pay and what that looks like. And primarily, this system is used in our rural counties right now and for smaller populations that have special needs. They're more specific groups of patients. The other delivery system is what we call Medicaid managed care. And that basically means the state of Nevada has a contract with a health insurance company like United Healthcare or Anthem or other names that you've probably seen a lot of commercials for or heard on TV. That is the name that's on your insurance card, right? And so that company is required to help pay the physician and help coordinate the care with you all, help you get access to doctors. They're the kind of go-between between the state and our providers and the state and our patients to be able to help run the Medicaid program. And right now, if you live in Washoe or Clark County, you have a managed care. You're more than likely have a managed care plan. So you have the name of an insurance company on your card.
I actually don't. I have fee for service.
You have fee for service. Okay, great. Yeah. So we probably have we have folks from all types of these delivery systems, right? But for small populations that have more specific care need, they are still in fee for service, which is probably simple, which is great. I think what's important to know is on January 1st of 2026, which I can't believe is coming up very soon, is in just about 4 months, we are transitioning all of our rural counties from fee for service to managed care. So that means it's broader than just our Washoe and Clark counties. It's across the full state. There will be some populations that are still in fee for service. Those include populations with special healthcare needs. Our tribal populations also can opt out and remain in fee for service. And some of our other services for kids with disabilities will remain in fee for service. But for the most part, will be more like 90% of the state will be in managed care. So I know that's a really complicated part of the way Nevada runs our program. And I will say every state looks different. Some states are totally blue. They have all fee for service. Some states are totally green. They've only ever had managed care. That's a choice a state makes. And that's a choice that the Nevada leaders made, many years ago to begin this transition to managed care. So any questions on that piece? Do you feel like you know whether you're in the blue bucket or the green bucket for your insurance? Yeah? Feels clear? Okay, good. So let's move to the next slide. Great. So one word that you probably saw before is a state plan. And this is where it's a little, if you're not interested in policy, this may be a little boring, so I'll move quickly. But I think it's important for you to know the state plan is the contract that we have with the federal government. So everything that we do within Medicaid has to start with our state plan. It's a very long document. It's available online. You can read it if you're interested. But this allows us to show who who is eligible for Medicaid coverage in Nevada, what services we pay for, who can enroll as a provider, how much we pay for it. All of those details are held within our state plan. And it is a little bit of a complicated process to update that. We have to draft that state plan amendment is what it's called, a SPA, which is a very fun little acronym that we like to use. So if you hear SPA, it's perhaps less fun than the word that you know or otherwise, but SPA is the way that we say, hey, CMS, hey, federal government, we want to make a change. And this is what that looks like. So we work with first all of our internal staff, and then we work with our stakeholders and get feedback from our community on what that amendment should look like. Once we have final draft, we send that to the federal government, and they have usually about 3 months. Often that gets extended. It can take as long as 2 years sometimes for that to be approved. We go back and forth with them. We work on the language, make sure it's super clear. And then finally, we receive an approval from them to make that change to our state plan. And then everything else on our end, we can update our systems, right? We can update our policy. All of those things happen once the state plan is in place. So this is really the backbone of our work. This is something I ask our team all the time. What does our state plan say, right? How does our state plan read on that particular area? Because that's really our guiding document for this program. Does that make sense? Cool. Okay, so let's move past the policy wonkiness. Let's talk about benefits. The first question is, how is care delivered within Medicaid, right? Whose name is on your insurance card? The second really important question in Medicaid is, what does Medicaid pay for? What services are paid for, right? Every insurance company in the US can make choices on what is covered under insurance, right? And so it looks different in every insurance company in every state. Within Medicaid, though, the federal government wants certain things to be consistent in all 50 states and all 6 territories. And those things are our mandatory benefits. So every single state plan includes these things. So these are hospital services. These are dental services for kids. These are labs and x-ray services, right? I won't read you every single one, but these are kind of the basics, right? This is the base level. We have to cover it. The federal government views this as really crucial care for every single person to have access to. The next slide shows optional state plan benefits. So things that each state can choose to cover and add on. So one example here, we'll talk about Nevada, but I think it's a good example, is dental services. So as of right now, in our state, only kids have access to dental services across the board. Some adults have access to certain dental services, but it's pretty limited. The legislature and our team decided that's a real priority. We believe that all adults in Nevada on Medicaid should have access to dental services. And so we put that in our budget and said, hey, legislature, we want to fund this. We want to add this optional benefit to our state plan. Would you give us money to do that? And they approved it. And so now we're in the process of updating our state plan, getting approval from the federal government on how to do it. But what that means is that optional benefit will now be part of the available service for every single recipient in Nevada, which is really exciting. So if you go to the next slide, what is covered and what is not covered in Nevada, I think is really important. So what is covered, things that hopefully you all have gotten access to already. So seeing your doctor, going to a hospital, getting therapy or other mental health services, eye exams and maternity care, long-term care is a really big one, right? About half of people in nursing homes in the state receive coverage through Medicaid. And so that's a very important benefit. Things that are not covered within Medicaid right now are cosmetic surgery, experimental treatments, alternative therapies, certain dental procedures. As we mentioned, that's a much smaller group of things that aren't covered now, which is really exciting. And transportation that's not related to medical care, right? So it's more of the add-on benefits. I will say some of these things within our managed care plans, they provide that as an additional benefit, right? They provide more transportation services, or they provide nutrition support or other things like that. They can make that choice within the managed care plan, but within our fee-for-service world and within our state plan, this is what's kind of in and out there. So any questions on that, or things that surprise you that you would think are on the list or aren't? Okay. It's a good thing if it feels like it's the right list for now. And this is what we'll be talking about, right? A lot of the things that we'll bring to this committee will be on what should go into that green box, right? What are optional benefits that we think we should add, or we have funding to add, and we want to know the right way to design them? Or things that are already in the green box, how do we make them better, right? We know we pay for it, but that doesn't always mean the access is good or you're getting the quality of care that you need. So how do we improve what's in that green box? Does that make sense? So let's move to the next slide. I think we have just a couple more. Yeah, so we're going to end here with talking about what are our advisory committees, right? What are we doing here? So if you actually want to move to the next slide, Erica, and then we can maybe bump back to this one. As you probably all know, or I hope you know, the BAC, this acronym stands for Beneficiary Advisory Council. So the purpose is for people that receive Medicaid coverage in the state or have a family member that they care for that does, for you all to give us direct feedback on the program that you're in. And so the point is to help other people who are in the Nevada program and to share your stories and ideas directly with us so we can hear your recommendations on how to make this better. So the goal is really, we view this as a partnership. We want to hear from you and we'll bring you things and you'll bring us things and we'll go back and forth on things. We're really excited to get that feedback and really to incorporate it in our policy, in our state plan amendment. So you may be famous. The words that you recommend may end up in that state plan amendment document. And we really hope that that is the case because that would be a reflection of your input and work being reflected in our program, which is great. So the folks that are part of our Beneficiary Advisory Council, as you probably all know, are people that use Medicaid, their families, and their supporters. So we want to thank you for your experience and dedication to this. I know this is taking even more time to talk about this program, and so I really am appreciative of everyone's willingness to do that. The other committee that we're starting also today, this afternoon, this is why today is my favorite day of the week, is if you want to go back one slide, the MAC, which is the other committee, the Medicaid Advisory Council. This is pretty similar. The purpose is also to give us feedback and to help us improve, but it also includes providers and other community members. So it's not exclusive to people that are part of the Medicaid program. So it's really important is that we first hear from the people that are on our program, and then we kind of broaden that table. We'll have more folks at the table this afternoon that have other perspectives that are important. But we believe that's what's really core to this work is our beneficiary input. So that's why you guys are first up. So if you move 2 slides down, Erica, thanks for hopping all over the place. The way these two work together will be, we'll meet on the same day. Every single quarter. We'll bring similar updates or ideas or questions to you, but the purpose is really to kind of complement the input and reflect both of your committee's input in whatever policy decisions or updates that we're making. So it's really going to be a collaborative process and we will share updates with you all on what that looks like. You want to move to the next slide? That's it. Wonderful. Thank you for your patience as I talked at you for a lot of info. What questions do you guys have? Does that generally make sense? Are there words that you're curious about, concepts, questions that you have on all things Medicaid?
Well, I just thought it was interesting when you were talking about like where most Medicaid patients are in Nevada, because I'm actually one of the 86,000 that receives both Medicaid and Medicare.
Okay.
I didn't know that. I didn't know that many or that few people in Nevada receive both Medicaid and Medicare.
Yeah.
So I just thought that was kind of interesting.
You're part of a special group. Absolutely. No, I think, was it 11%? I'm trying to remember.
Yeah,
It was 11?
Yeah, the 11%.
Okay. Yeah. So that's a great, thank you for remembering that because I hadn't mentioned that. So 1 in 10 people in Nevada, so 11%, about 86,000 people, receive both Medicaid and Medicare. And there's a lot of different reasons why folks can be eligible for both programs, but they really work to complement each other. Medicaid helps pay for some of the co-pays or other costs within Medicare. So they're kind of complementary programs. And we work really hard to make sure that the folks that are part of that special 86,000 people have all the information they needed. So I'm really excited that you're part of this and can give us feedback on it, because I think that's not always something that's as clearly talked about in our Medicaid work, but it's really important and we want to make sure it works for you. So thanks for pointing that out. It's great. Anyone else?
I thought it was really impressive. Well, the number that 1 out of 2 births are covered by Medicaid. That's a very big number.
Yes.
And the infant care and maternal care, I think, is really important to prioritize at that point.
Absolutely. No, I appreciate you sharing that. And I think it was Brooke as well who had shared an experience with that too. That's a really challenging time of life for anyone who's been through it. And there's a lot of medical needs that are really complicated. And if it's 1 in 2 babies in our state, you can imagine how many different complications and needs there are for all of our patients, and finding a way to better support everyone wherever they're at in that process is really important to us. So I really appreciate you calling that out. It's something I think about every day, right? Every single day, how many babies are born in our state that are covered by Medicaid, and how can we do right by them and by their, it's really important. So I appreciate you.
And I think maybe want to give an opportunity for our council members online to see if they have any additional comments or any questions on Ann's presentation.
I'm trying to click on the mic button, so sorry that my camera keeps popping up. But I'm not sure exactly if these are things that like benefits that are derived from welfare or Medicaid, but like there's so many things that are offered. Like I get a free Sam's Club membership. Obviously like glasses and just so many different things. Is that from Medicaid or is that through welfare?
That's a great question, Rook. Yes, that is likely through Medicaid, and that's probably through your managed care organizations. Do you know like what the company's name is on your insurance card?
Yeah, I have Health Plan of Nevada.
Yeah, so okay, great. So HPN, the Health Plan of Nevada, they offer kind of additional benefits to their patients. All of the insurers do. It just looks different for every insurance company. So HPN has things like Sam's Club, has things like glasses, right? To make sure that folks have access to all the things that you need and also that impact your health, right? There's certain things that are not Medicaid benefits, but help benefit your health. Things like access to good food, right? Access to transportation. And so that's where our health insurance companies can really help because they have the ability to pay for those things that we don't always. So I'm really glad to hear that, Brooke. That's really helpful.
I don't have any questions necessarily, but thank you for the statistics, and it was very informative.
Absolutely. I'm glad to hear, Kaylani. That's wonderful. I'm also excited that you're a provider with us, Kaylani. That's wonderful. And I'd love to pick your brain on our work. I know one of the optional benefits that we recently covered is doula care, right? And that's a really important part of supporting patients throughout birth. And so I'd love at some point to hear from you on how that experience has been and how we can improve that, because that's pretty new for us to be able to pay for it.
Yes, I'll actually be at the next meeting, so I'm really excited to participate in that as well.
Great. Wonderful. I'm looking forward to it. That sounds good.
All right. Any other questions for Ann? Okay. I think we'll move on to our next agenda item. Pull that up. All right. Oh, it's me. Okay. All right. Good morning, everyone. For the record, my name is Nahibi Flores-Rosiles. I am the Tribal and Community Liaison with the Nevada Health Authority. And then I am also part of the MAC and BAC support staff team with the Community and Provider Engagement Unit. And so excited to be here. This meeting and this committee council have been a work in progress for the last couple of months. And so just very excited for this to be happening right now. And so now we will be moving on to our next agenda item, which is our Beneficiary Advisory Council orientation. We just wanted to kind of give a little bit of background of some of the logistics as well. So for our agenda, we will be covering a couple of things, some housekeeping. We want to get to know you guys a little bit more. We will go through our engaged feedback checklist. That we've kind of wanted to start. Logistics, travel support, compensation, and vendor registration, those types of logistics, and then go over any other resources and support that we can provide. All right. So for the housekeeping items, this is just on how to use Teams and that we record these meetings. And so we are using Microsoft Teams. Participants are joining by both computer and phone. Everyone will be automatically muted upon entry in these meetings. Please make sure to include your name and organization, if applicable, when using the chat box. And you can use the chat box to submit questions. And these meetings will be recorded and transcribed. If you would like a copy of the meeting transcript, you can reach out to us at communityandprovider@nvha.nv.gov. And if you have a question for those online, you can use the chat or raise hand feature on Teams. If you're listening by phone, you can press *6 to unmute your audio or *5 to raise your hand. All right. So like I said, we do want to get to know you guys a little bit more. And I know we've already kind of done some introductions. And so to kind of kick things off, we want to go around the table. And for those online, we want you to share a bit about yourselves to better understand the diverse perspectives that we have here at the table today. And so if you could share a little bit of an introduction of who you are, your name and background, however you'd like to share that. Where you are from so that we can see the different places we're representing here in Nevada today, and then what you hope to gain from this council, whether it's insights, connections, or a chance to advocate for a specific cause. We want to know what those things are. So maybe we can start with Azraella.
Oh, okay.
Sorry to put you on the spot.
That's all right. I'm Azraella Gravel. I have a master's of public health and epidemiology and a master's of science and organizational behavior. I'm from Ohio originally, but I have been here for about 6+ years now. What I hope to gain from this council is I noticed that 40% of Medicaid recipients are children, ages 0 to 18. I hope that with our uncertain times in the federal government, that those children will continue to receive aid via Medicaid, and that, I don't know, that's probably what I would support the most.
And you are local to Washoe County?
Oh, yeah.
You know?
Yeah, I'm in the confidential address program, so I won't disclose where I'm
No, that's
actually at, but yeah, I'm northern
Nevada. Okay, perfect.
Do you want me?
Oh, sorry. Yeah.
Oh,
no,
sorry.
sorry.
I thought you were doing just like popcorn reading. All right. So I'm Bill Sims. I live in Reno. I'm just your average video gamer. I've been on Medicaid pretty much my whole adult life because I do have cerebral palsy. And what I hope to gain from this council is for as long as I've been on Medicaid, both in Nevada and Utah and everything, I would hope that I'm able to gain insight in how we can, expand services for people and to be able to make things a little bit more easier on patients, like when they're having to get prescriptions and things like that, and just making it easier process for patients so that they don't always have to go back and forth between the pharmacist and the doctor and so on and so forth. So I just hope that when I'm able to gain this, that, we're able to help everyone on Medicaid, make it easier for them. So.
Thank you.
What video games do you like?
Well, like back in the day, I used to play a lot of Resident Evil, but nowadays I just play a lot of GTA Online. So.
Sounds good.
Grace?
Yeah, so Grace Larkins, once again. I am here really to kind of hopefully represent other families who have children and youth with special healthcare needs. I have a really big friend group now after these years of other parents who also have kids with complex needs, and we just learned so much from each other. And it's kind of why I went back to school, back to university, pursued social work after I was in the nonprofit arts management for decades, and kind of went back directly to be able to immerse myself in other families kind of going through what can be really, really hard and scary when diagnosis or crises or these things come up. So in general, it's, folks with disabilities and other families. I love, I get a lot of that sort of inside info because we really guide each other a lot. So I just felt like that was a really good opportunity to kind of share that, because then I could bring it back to the table to those folks. I also, the last couple of years, have led a statewide durable medical equipment work group. So that's originally kind of based out of complex mobility equipment, because it can take like 1.5 years to get a wheelchair, this kind of thing. So that's kind of grown into this sort of great kind of grounds for kind of research and digging in, and kind of came back to that systemic sort of layout of things. And so this seemed like such a great place to see how, we can kind of line those things up. So
Yeah.
And how, you said your daughter's?
she's 10 and a half.
That's
matters.
important.
Sure does.
What's her name?
Lucy.
Lucy. Cool.
Awesome. Perfect. And we'll move on to our council members online. I'll maybe pick Kaylani to start us off.
Yes, my name is Kaylani Queen. I am from Las Vegas. I've been out here in Vegas since the late 90s. I am a Medicaid recipient and a single mother of two. I am also a Medicaid doula out here as well, so I'm able to serve multiple communities in Vegas and outside of Vegas. And I am excited to be a part of this committee. So thank you for having me.
Thank you, Kaylani. And Brooke.
Hi, I'm Brooke. I'm from Las Vegas, born and raised. I hope to advocate for substance abuse programs that are really the lack thereof that we have in the state. I have a family member who has struggled with substance abuse problems for a while now. And I guess what I've learned through that is that they say you can lead a horse to water, but you can't make it drink. And as much as you want someone to do better, and not have to struggle or see them, go through hardships or whatnot, if they're not ready to, they're, you can't force that on them. But it's been heartbreaking because, the West Care facilities that are offered here, I know one of them that my family member attended, they were just, I guess you're in a really vulnerable state of mind during that time. I could only imagine. Like, I mean, I don't know, but I just know it was really hard for them because the West Care facility that they attended was not only a detox center, but a vagrant shelter as well. So that was kind of off-putting for them, and they didn't want to be there. And it really sucked because I felt so helpless, because there wasn't really any. I mean, Nevada and Hawaii are the only two states that don't have like other nonprofits or privately funded facilities that are you can go to and not have to pay for through grants or what have you. This was a few years ago. That I mean, that might have changed now, I'm not sure, but there's not too much. It just seems like I'm so glad that this council committee has given Medicaid members a chance to actually speak up, and I'm just hoping that through our experiences that some good changes can be implemented. And I'm thankful for the opportunity to share any insights that pertain to that.
Absolutely. Thank you, Brooke, for sharing. Yeah, I mean, this council is here to bring your perspectives, your experience. We really want to hear from you all. And so we want to make this as comfortable as we can for you all to, feel like you can speak up. I know that these things could be a little bit awkward or maybe a little bit intimidating, but please let us know how we can make that better so that we can have engaged conversations and such. So thank you all for sharing. I did also want to ask, does anybody have any experience working on a council or a committee previously? And that's okay if you don't.
I did.
You
I
did?
do.
Okay, awesome.
I was in the Ohio or Cincinnati Health Department, and I was on evaluation committee for that city.
Awesome. Awesome. Cool.
For public health.
Yeah. Awesome. Okay. Okay. Anyone online? Okay. Awesome. Perfect. Well, thank you for sharing, everybody. And we'll move on to our next slide. So something that we wanted to bring to this council to help make these conversations, to keep them comfortable and keep conversations, I guess, respectful and that we're, actively listening. We wanted to bring what we're calling an engaged feedback checklist. And so, like I said, we want to ensure that this is a safe space for everyone. And so before we jump into our discussion today, we wanted to take a few minutes to create a set of guidelines that will help us have a productive and respectful conversation. And so we'd like to hear from all of you about what behaviors or principles are important to you all in creating that safe space. And so we did put just two little options on there of what we think that could be helpful for these conversations, so that we all commit to being an active listener, and then always be respectful of others. And so we wanted to open it up and see if you guys wanted to add anything to this list. And if you don't feel comfortable speaking, we also have some sticky notes, I believe, on the table. And yes, there we go. And if you want to pass those around, Bill, that would be helpful too. And we have some markers as well. We have up here a sticky note pad hanging up, and so you can come and write them down.
Thank
And
you.
then we can kind of go over a few things. But would anybody like to maybe say any that they think could be helpful to add to this list?
I do. Since we have an hybrid online and in-person meeting, being respectful of the online community as well, because maybe somebody's talking and they had like an opinion, but they don't like raise their hand because of the audio or some type of glitch online. Maybe giving them an opportunity to speak while we're in transition, or just offering them a chance to speak more often.
Okay, that's great. So kind of keeping our virtual attendees always in mind, maybe pausing for a second before we move on to our next question or topic, to kind of give them an opportunity to speak. And we do hope to have these meetings both in Northern Nevada, different locations within Northern Nevada, hopefully, and also Southern Nevada. So if you guys know the space that we can hold these meetings in either of those locations, please let us know. But we hope to do that so that those that live in the Southern Nevada region can come to in-person meetings and have, because sometimes it is a little bit easier to have those conversations in person than being online. So thank you for that. Awesome. Anything else you want to add to this list? Maybe we open it up to Brooke and Kaylani online.
Are we supposed to raise our hand before we mute ourselves? Or is that just for like an in-person?
No, yeah, you don't need to. It is helpful for us because we'll see it on the screen. But if you're unable to or you can't figure out the buttons, that's okay. Just feel free to jump in.
Okay,
And
gotcha.
introduce yourself if you can.
I just wanted to say just like maybe I'm sure a lot of people are going to share different opinions and experiences, and just to radiate positivity, and there's enough like ugliness in the world. If you disagree with something, I don't think things should be up for debate or anything. Just try to keep things positive, whether you have a different experience or agree with them or not, or a different outlook. Just to be keep things positive in general.
It's awesome. I love that. Yeah, radiating positivity. I love that.
I think one I'd like to add, I might get the phrase wrong, but something about like keep the lessons but leave the stories. I think it's really, there's a lot of vulnerable things that people will share and have already been really generous to share here. And I want to respect that and acknowledge that we don't need to share what those stories are outside of this room. I think there's a lot we'll take from your stories and feedback with us, and we'll incorporate it in our policy. But I commit to not using details of the stories that you share unless that you ask that we do, because I really want to respect that you can share things that may feel more personal, and those won't be shared more broadly from there. That seem reasonable?
Yes. Yeah, I think that's a good point to bring up. These meetings are public and they are posted online, so anybody can join. However, that is why we wanted to kind of provide some sticky notes so that if you don't feel comfortable sharing certain items, you can write it down. You can always send us an email outside of these meetings and we can, have that feedback. And so, yeah, I think that's super important to kind of reiterate. So, yeah.
But I've got one. I think I've already observed that y'all are really cognizant of it, and I think it's fantastic. But acronyms and terms, those are thrown around just as a matter of course. And so a lot of times it's, I know when I first started in my position, university, I instantly put together an Excel spreadsheet of acronyms, and it's just grown over the years, and it's incredible. So that just to kind of always kind of keep that reference when we refer to things, to kind of give the long form of them or explanation of just sort of different lingo as it comes up. And it's good for us to hear those and learn, learn them anyways. So it's like a little extra learning
Yeah.
experience.
I would add to that, if we ever do, please just call me out, right? Like raise your hand and be like, hey, can you explain that? Like, don't hesitate to interrupt or ask for that, because it's not on you, but I also want to make sure that there's never a moment where you're like, I'm curious what that means, right? Like just ask and we'll talk about it. Because you're right. If one person has a question, probably more people do. And it's worth trying to take a moment to explain what it is. So that's a great one.
And we did have a comment in the chat from Amber. It says, could a copy of the document and slide deck presented today please be available to all? And that will be available on our website once this meeting's over, probably tomorrow by the time we get that up there.
Yes, yeah, all documents will be posted online.
I did want to notate, I do have a location that we could possibly look into for Las Vegas meetings. It's the Anthem Community Wellness Center on East Bonanza. It is from Anthem Blue Cross Blue Shield. It's a nonprofit, and they allow nonprofit organizations to meet there. So
Thank you, Kaylani. That's super helpful. If someone could write that down, and then we can start reaching out. That's perfect. Thank you.
It's great.
no worries.
And kind of touching on the acronyms in plain language, if it's helpful for you all, we can kind of start putting together maybe a list of acronyms that are commonly used when talking about Medicaid. If that's helpful at all, we could try to put that together and send it to you all. Have that as a resource for sure.
I can email you mine.
Yeah, that's start. I'm sure we'll come
Yeah.
back.
We have one for our staff
I'm
too,
sure.
because there's so many. So I think a combination would be perfect. Yeah, we'll cover all the bases.
Yes.
Anything else we would like to add to our engaged feedback checklist? And if you can't think of anything now, like I said, you can write it on a sticky note. Or if you think of something later on in the meeting, write it down and we can add it to our list. We will put a list together, like a more formally drafted list, and then bring that to our next meeting and meetings that are, our future meetings to kind of keep these things in mind. Yes.
I was gonna say that, if there's ever something that you aren't sure that would be applicable to this, say it anyway. Be willing to, just kind of think outside the box.
Mm-hmm.
If you're not quite sure, be okay with just asking. Because you never know, it might not be applicable to the whole group, but it might be, something that someone else would, want to hear, so that, we can get more feedback on whatever we might be talking about.
That's great.
That's perfect. It's awesome. I think no question is too silly.
Yeah.
So,
Yeah.
we definitely want to ask them all. Any other comments from those online? And like I said, if you can't think of anything else to add, please write it down or share it with us later, and we can add that to our list. So I've been writing all sorts of notes over here on the side. I don't know if the people online can see me, but yeah, so, all right. We'll kind of go from there. Okay. Can move on to our next slide, and we'll go over some logistics. And so to kind of capture some things that us as support staff need, we have created a contact information form. And so it's just a survey that kind of asks about your preferred contact methods, scheduling needs, accessibility needs, and then some questions around compensation if you are eligible. And you can scan the QR code, and this is for council members only. So you can scan the QR code. We also have some paper forms as well, if you'd like to fill those out here, and we'll take those. And then we also have the link posted there too, if you want to type it in. You can do it now if you want to, or we could also, you could do it at a later time as well. Yes.
Is there a Wi-Fi password?
If there's a guest.
There is a guest Wi-Fi. Let me go check with our team and see. They change it every month, so let me go get that and then we'll share it with you. Yeah, that's a good one.
And so, yeah, preferred contact method, we just want to know whether that's through email, phone, or another method. And this ensures that we can stay in touch that way. And then scheduling needs, if there are any specific times or days that work better for you or don't work at all for you for these meetings, so please let us know so that we can try to accommodate as many people's schedules as we can. And then if there are any accessibility requirements that would make participating in these meetings easier, to please let us know, whether that's language interpretation, captioning, physical accommodations, please share those to us to ensure a comfortable and inclusive experience for all. And then compensation preferences. So we want to respect your time and efforts for showing up and participating in these meetings. So please indicate how you would prefer to be compensated for your participation. This is the stipend is available for current Medicaid recipients. And we want to make sure you're fairly compensated in a way that works best for you. So like I said, please feel free to fill out this form. And yeah. And we'll share this information after the meeting as well. Yes.
I'm not super familiar with the Teams thing application, and I know when I first joined the meeting, I had clicked on something and it went to open a new window, and it totally kicked me out. So if I click on that link, will it open in this Teams thing, or I just don't want to get kicked out?
It shouldn't kick you out. However, Brooke, let's maybe wait, and I can send you don't need to fill this out right here at this minute. So we can send you this link after, and you can fill it out at a later time if that's okay.
I actually saw it on the orientation agenda, so I don't I have that information. But thank you.
Okay, perfect. Awesome. All right. Any questions on that, either in the room or online? Awesome. Okay. On our next slide, we will go over some travel support. So we can help cover travel costs to attend these meetings in person, including transportation, meals, and lodging. To receive these supports for travel, you will need to do two things: complete a travel packet and register as a vendor with the state of Nevada. So the first step is to complete the travel packet, which includes the necessary forms to request reimbursement. And the packet will ask for travel details like the dates of travel, method of transportation, meal expenses, and pre-specified lodging locations based on the location of the meeting. And so we will try to actually have some of these things pre-filled for you just to make things easier, especially as we know more of the details of where the meeting will be located ahead of time. And so we will make these packets available. I think they are included in your orientation guide so that you can fill them out at your own convenience. And if you're unsure of anything about the packet, please reach out to us, and we're happy to sit down and help support you in that and filling it out. So, the second thing is to register as a vendor with the state of Nevada. In order to process your travel reimbursements, you'll need to register as a vendor. And this is a simple process where you provide your banking information for direct deposit, ensuring that reimbursements are sent to you quickly and securely. The vendor registration process sometimes takes a little bit of time. However, we encourage you to complete it as soon as you can and to try to avoid delays in that.
Is there a fee to register?
There's not a fee to register. It is free. And to register, you'll need to go to we have a paper in the orientation packet that you can fill out, and we can try to send it to the state controller's office, which does a vendor registration, or you could also do it online, and we have that link for you as well available. And again, if you're unsure of how to go through that process or have a question about anything on that, please let us know and we can help fill that out for you. Just want to make sure I have touched on all of those things. For future meetings, if you are interested in traveling, for example, if we are having a meeting in Southern Nevada and the Northern Nevada participants would like to go down, or the Southern Nevada participants would like to come up to Northern Nevada for this meeting, please let us know either within 5 days of the agenda being posted, just so that we can kind of get that process going, because it does take a little bit of time. We're, like I said, happy to support you in any questions and things that you might have about that. Do you have any questions currently about that? Brooke, Kaylani online? Any questions about this so far? Okay.
No, I don't have any
No,
questions.
no questions.
Okay, perfect,
Well,
thank
actually,
you.
I do have a question. Is there any way to make this? Because when I got kicked out earlier, I noticed that when I joined the meeting, it had opened it in, I'm in desktop mode. And when I unselected that is when it kicked me out. I can't see you guys because it's very small since it's in this desktop mode. Is there like a setting somewhere where I can see this bigger?
I think it's under, can I test it out really quick? Just want to see, I'm gonna use your mouse. Oh, oops, not that. There we go. Is it like?
Maybe view.
A view, okay. If there's an option, I don't know if you're on your phone or on your computer, but there may be an option at the top that says view. And if you click on, probably speaker, the speaker, it will highlight the view where somebody is speaking from. So if we're speaking here in the room, it will highlight that and it'll be kind of like on a bigger screen for you.
You can also click on picture and whoever's talking, it'll enlarge, and then you can click back to the PowerPoint to go back to that.
Yes. Did you hear that, Brooke? That you can
Yeah,
click
yeah,
on
I
a
did.
picture and it should enlarge. Okay.
Yeah.
Okay,
Hopefully that's
awesome. Thank you.
helpful. And if not, we can definitely maybe sit down, either before our next meeting or, before our future meetings and kind of maybe walk you through or do like a practice run for sure.
I think next time I'll probably use my Chromebook instead of my phone so I don't keep hitting because the mic button is so small and it's right next to the camera button. I keep hitting the wrong one. So I'll just use a bigger screen next time. Thank you though.
Okay. Yes, no problem.
Not necessarily a question, but I filled out the form. I put my availability will be 5 to 8, but it's possible that I'll be available mornings and afternoons. I'll just know for sure by the end of this month. So.
Okay, awesome. Thank you. Okay. Now we can move to the next slide, please. Okay. So again, want to touch on the compensation piece of all of this, and I think Bill walked out for a second, but we can also go over this when he returns or at a later time. We understand that your time is valuable, and as a token of our appreciation for your involvement in the Beneficiary Advisory Council and the Medicaid Advisory Committee meetings, we do offer compensation to help recognize your contributions. So if you are a Nevada Medicaid recipient and are interested, the state of Nevada can compensate you with a $75 stipend for your participation in these meetings. And just as a disclaimer, compensation is considered income and could affect your eligibility. But if you have any questions around that, please reach out to us and we can look into that for you. Again, you will need to enroll as a vendor with the state of Nevada to be paid. If you need any support on this, you can reach out to us again. And I think right there is the controller's office website, and we'll definitely be sharing that link after the meeting. So. And then really just wanted to touch on any resources and support. So for any more information, you can refer to your BAC orientation guide. This guide is an essential resource for understanding the roles, responsibilities, and expectations of BAC members. It also includes all travel forms, the vendor registration form, and much more. We also have a website. You can visit the BAC website, and the URL is kind of long. It's dhcfp.nv.gov/boards.
I put it in the chat.
Okay, and Minden has also thrown it in the chat /boards/admin support/pack/home / So we wish that we could make that. We wish that we could make that a little bit shorter. We'll have to look into that actually. But that is it for now. You can click there, or if you want to send us an email, we can send you the link if that's easier. For any general BAC support, you can email our inbox at communityandprovider@nvha.nv.gov. And really, I think the last piece of this is to see if anyone has any other questions on this.
I have a question.
Yes.
So you said that Nevada Medicaid recipients will be compensated $75 for our participation in the BAC meeting,
Mhm.
but is that also included in the MAC meetings?
Correct.
So
Yes.
is
So
it $75 in total, or is it both?
per meeting.
Okay, per meeting.
Yes. Yeah.
And then I saw that in the travel expenses, it said that our meals are provided for if we,
So they're not provided for. You would get a per diem rate. And so you'd get a certain amount to, I guess, spend, and then you'd kind of go on your own and purchase meals, and then we reimburse you at that GSA rate, which is determined by the federal government.
okay.
So,
And
we
that's
can
listed here.
I believe the GSA rates are listed in there, and
Yeah.
if not, we can get that information for you as well.
Awesome.
And that also goes for lodging. There are GSA rates for lodging as well. Yeah, if you need help with those items, and like I said, we'll try to pre-select hotels before that cover the GSA rate, so that we don't have any issues and things.
So keep receipts.
Yes, yes, for sure. And I see we do have a hand, Monica.
Thank you so much. Good morning, everybody. I just wanted to, while we're talking about the compensation and reimbursements, I just wanted to make sure that we had information available for our recipients that the general reimbursement for travel is the same as if you are a state employee. So there are some requirements around how far you travel, where you travel, and I'm not sure who was speaking in the room. It could also be helpful if we introduce who we are when we start speaking. For those online, that would be helpful. But for instance, like per diem rates do not require a receipt. It's just a flat rate that the federal government puts out for a meal reimbursement. So we might look possibly at expanding information on those reimbursements. And I just wanted to make sure we brought that piece up. But thank you so much.
Yeah, I think that's probably something that we'll expand on and maybe add to this packet, kind of the different requirements around travel. And like Monica said, they're the same requirements as if you were a state employee and we're doing travel.
Yeah.
So we'll definitely share that. Yeah.
Hi, Melinda Southard. I'm a deputy director here at the Nevada Health Authority for Community Engagement and Workforce Development. Nice to meet you all. I did just want to clarify too that, you don't need receipts for the meal reimbursement. It's mainly for the, the hotel is the main receipt that you'll need for that reimbursement. So
Yes.
Kaylani.
And Kaylani.
Yes, I was just curious if we know when the next meeting will be.
Yes, and that is later on our agenda, but our next meeting will be November 13th, I believe.
Okay, perfect.
November 11th.
On Veterans Day?
November 10th.
Yeah, I was like, isn't that Veterans Day?
November 10th.
Yeah.
November 10th. Any other questions from either those online or in the room? I see Brooke put something in the chat. TinyURL is a great website to utilize for the purpose of shortening obnoxiously long websites. Yeah. We will definitely need to look into that. I think that we probably should do that. Okay. Any questions on that? Bill, I know you kind of stepped out for a second. That's okay. We can go over any questions that you might have later as well.
Okay.
So, yeah. All right. And then just a little list of acronyms. Sometimes we refer to the Medicaid Advisory Committee as the MAC, and then the Beneficiary Advisory Council as the BAC, and then NVHA stands for the Nevada Health Authority. Perfect. Awesome. So I am going to go ahead and pass it right over to Ann who will discuss or will do our next agenda item, the discussion of the chair and vice.
Absolutely. So as always, within committees, there's a lot of different kind of formalities, but important roles to play throughout this process. So excited to share a little bit more about, for us in particular, for the BAC, what that looks like. So the goal is to designate both a chair and a vice chair for the BAC that will help kind of facilitate the meetings. They'll work with the BAC support team, these folks right here that are really awesome and fun to work with, on the agenda and teeing up some important discussion questions for the group. Just kind of play a role in the planning, preparation, and also some of the debrief after the meeting as well. So the chair typically leads the meeting with the support of the BAC support team, and then the vice chair will fill in for them and kind of be in a supporting role as well. So we usually fill those roles through a nomination process. So you can either nominate yourself or someone else for it. Spend some time thinking about it. We don't want to put anyone on the spot for this, and it's something that you're welcome to do if you're interested. And if you have questions about it, you can talk to this team right here about what that would look like or the time commitment involved. But within the next 2 weeks, we'd like nominations to be sent over email. And then before the next meeting, we'll follow up with next steps on the selection. And then at that next meeting, we'll make that announcement on who will be the chair and vice chair there. So anything from the team that I may have missed on that, or does that?
No, I think if you are interested in being considered a chair or vice chair, so please let us know. You can email us at communityandprovider@nvha.nv.gov. Please let us know within the next couple of weeks.
Question. This is a 1-year term, is that correct?
Some are 1 year, some are 2-year terms.
I mean, in general, being on the chair, on the committee.
The chair and vice chair. I may have Monica. Yeah, I already see her hand raised. Monica, can you jump in on that and maybe answer that question?
Hi, good morning again, everybody. I'm sorry I didn't introduce myself other than my first name. My name is Monica Schiffer, and I'm the External Stakeholder Chief with the Nevada Health Authority, and very happy to see all of you folks this morning. Because this committee, along with the Medicaid Advisory Committee, this council is brand new, in order to ensure that we didn't have to turn over the entire council at one time, the first set of appointments are staggered. So some appointments were for 1 year and some appointments were for 2 years. If you do get nominated or nominate yourself and are chosen to serve in either the chair or the vice chair position, that will follow your term. So if you've been appointed for a 1-year term, that will be a 1-year chairmanship. And if you were appointed for 2 years, you would serve in that role for the 2 years, unless something happened and you needed to resign or anything like that.
And our Grace Larkins, for the record. Are we able to apply again to be on one of the committee or the council after, this 2 years? Can we still participate?
Yes, you can. They just cannot be consecutive terms.
Gotcha.
Yes.
Okay.
Yeah. Anything you want to add on to that, Monica?
No, I did just want to say that this, some of the legislation that was written in is that, yes, just like Nahivi said, absolutely, you can come back. It just cannot be consecutive.
So when emailing the community and provider email address for those that are interested in the chair positions, is there certain criteria that you guys are wanting in the email, or just like, hey, I'm interested kind of thing?
I think just your interest in, Monica, do you want to add anything else? I think mostly just your interest. Mm-hmm. Yeah. I think just interest, Brooke, and then we'll kind of go from there and see if we have any other additional questions in the nomination process.
Yes, awesome. Thank you so much.
Thank you, Brooke. Okay. Any other questions on that? Okay. And really quickly, I know Ann is still on for this agenda item and for the next one. The next one is more of a discussion again. And so I just wanted to see if we wanted to take like maybe a 5-minute break. Because I know this is a longer meeting. And maybe some people need to take a restroom break or anything like that. Do we want to take a 5-minute break?
I'm up for a break.
Yeah, sure. We can get some more coffee.
Okay. Okay,
Sounds great.
so for those online, we are going to take a 5-minute break and reconvene at 10:20. Thank you, everyone.
Perfect.
For those of you online, this is Monica Schiffer with Nevada Health Authority, and the meeting is currently in a break scheduled to resume at 10:20. Thank you so much.
Who are we looking for? Who are we looking for?
Hi, good morning. This is Monica with Nevada Health Authority. Andy, did you have a question? The meeting is currently in a break and will be resuming in about 1 minute.
I'm just curious because I'm one of the members that's doing this online. Did you guys, for those that are there in person, was there like any kind of like snacks or get together kind of thing like before the meeting? Because I was just thinking like that'd be another great way to be compensated. It would be like snacks after the meeting or something. I don't know if that's something you guys are doing or if we could do, but down for some cookies.
Yeah, we do. Are we on mute? We are, so we do actually have some refreshments here in person. I'm sorry we couldn't bring those to you over there in Southern Nevada. However, we will try to have some sort of refreshments at all of our meetings because we understand that these are longer meetings and we don't want you to be starving while we're here, so. Thank you, Brooke, for the question. All right. And it is 10:20. I might give it just one more minute as we still have some council members that are still out. So just give it one more second. Thank you.
Hey, so should I turn this off?
Yeah, I can take it.
Oh, yeah.
Yeah.
I just wasn't sure.
Yeah.
Just in case you guys are like, oh, no,
Yeah.
no, here.
No, that's
So-
okay. Yeah. If you need another copy, I can get that.
Okay.
Yeah. Thank you.
So. I'm sorry. You're Melinda? Yeah, you are. Okay. So this is neat because I'm getting to see people in person that I've, heard about or emailed, or I actually had emailed you recently and you did respond.
Hello.
Appreciate
Oh, good.
it. It was, yeah, regarding a Katie Beckett
For those
case. My own daughter's
online,
Katie
you're
Beckett
just
case,
gonna get
actually.
one more second. We're just
Anyhow,
waiting
it's just
on
nice to see
our
you.
presenter for the next item.
Yes, happy to help wherever I can.
I have a couple of different.
Okay, everyone, it is 10:23, so we are gonna jump right back into our agenda. Moving on to agenda topic number 8, the administrator's report with Ann Jensen.
Awesome. I'm gonna try to make this more discussion based. There's a lot of info coming your way, so stop me at any time. But there's 3 things that I wanted to give you updates on today. The first is on the Nevada legislative session and what happened that impacts Medicaid there. The second is on the transition to statewide managed care, what I mentioned earlier, where all of our rural counties are getting managed care on January 1st, and get your feedback on how we can best do that. And then the last piece is on our children's behavioral health transformation, get your input and give you some updates on what we're looking on there. So those are the 3 things that we're gonna talk about and where we're headed. I'll start with the legislative session side. So for those in the room and then also those online, I would love to hear from each of you. Is that something that you guys have followed before in Nevada? Are you aware of what happens with legislative session, or is that a pretty new process to you? We welcome whatever you're coming from. I just want to make sure I know where everyone's experience is with legislative session.
I've given commentary on every legislative session since 2017, so.
Nice, that's awesome. Okay, so you've
I'm
given.
pretty aware of it.
Yeah, so you've given testimony, public
Yes,
testimony,
quite
which
a lot.
for folks that maybe are less familiar, for every hearing on a bill, there is an opportunity for folks to give commentary in support of a bill or in opposition or in neutral, just to give some input on it. So that's open to any member of the public, and I'm really excited that you did that. That's great. That's a brave thing to do. It was hard.
Yeah.
Did you go sit at the table?
Yes.
That's awesome. That's awesome. Yeah, that makes me nervous. So I'm impressed.
It definitely does.
That's great. That's great. Anyone else have experience?
I've attended,
Oh yeah, go ahead, Kehlani.
Yes, I have with the Nevada State Board of Cosmetology. So I have a little bit of experience with that board.
Nice. Oh, awesome. Okay, great. Thanks for sharing that.
Grace Larkins here. I have followed the legislative sessions, the last couple, relatively closely. I did the Nevada Governor's Council, the DD Council's Partners in Policymaking class, which originally got me exposed to it. This recent session that just closed, I'm super excited and kind of proud to say that SB 185, which was Senator Taylor's bill around paid family caregivers, that stemmed from my friend group of parents starting in 23. We kind of made that our group push, our group issue, and one of my other parent friends spoke with her directly, and it really stuck, and I guess, and so that ended up moving forward. And then this session, I met with Senator Krasner and she committed to signing on as the co-sponsor, which brought it bipartisan and actually made it go through. So you see, I just get very excited to see it actually in progress and see it happen. It was just really wonderful to think that it would have these like long-term effects on other people. So I'm really interested in the policy side of things because I think that's where a lot of things that's where a lot of good change can really happen.
Yeah, that's wonderful. Thank you for your work on that. I remember we worked very closely with Senator Taylor on that bill, and I'll talk about why and what that looks like on our end. But I remember sitting in the first hearing for that bill, and I think there was over 90 minutes of testimony and support. And it was really some really beautiful and powerful stories that families shared. So I just want to thank you for that. That's really exciting. And we will bring SB 185 as one of the bills. We can do that to you all to get input on how we implement it. And then I'll talk about what that means, but I'm really excited to have your perspective in that conversation. That's great. Awesome. Anyone else?
Azraella here. I have experience in legal epidemiology. So in public health, there's a lot of raw data that goes unprocessed and doesn't make its way to legislature. And so my job was to bring valuable data to Congresspeople, and then they can make more informed decisions on that at a federal level. In Ohio, not necessarily in Nevada, but in Ohio, we passed the legislature to increase tobacco use to 18 years old. And I was on that project and I did a lot of work on that. So I was pretty happy with that. And then also we helped maternal health as well on cessation of tobacco use. And so I was on that project as well.
That's awesome.
Thanks.
Wow. I'd be curious to hear your experience when you hear more about Nevada's process and you see we'll probably bring more things to it through this council. But every state's legislative session looks so different. And so I'd be curious how it compares on the Ohio side. So that's great.
Yeah.
Do you know, was there a session every year or every other year?
So a lot of it depended on local support or local governments. And then at a state level, they brought it to a state level and then it went to a federal level. So it was really local heavy. I feel like in Nevada, it's more state heavy. So having local support and local stakeholders involved is really important.
Yeah, for sure. That's really great. Thank you for sharing that. That's awesome. Brooke, anything you want to share on that? Or have you have any experience with the legislative session, or is this newer to you?
No, I'm not. I don't think so. I recall like in government class, we had to write a bill, and I know mine went through to the finals and got like sent on actually to be passed. But I don't remember whatever came of that. But that's like all the relation I have to that kind of thing.
No, that's great. You probably learned a lot that I could benefit from in my class. So that's wonderful. Thanks for sharing.
Yeah,
cool.
very
So
specific formatting.
Yeah, oh gosh, yeah. That drove me crazy this year. all the font color and yes. So yeah, here in Nevada, the legislative session happens every other year. So in some states, it's every year for a shorter amount of time. Some states, it's all the time. Like in California, they have session year round all the time. So we feel pretty thankful that's not our situation because it takes up a lot of time and energy. But in Nevada, it's 120 days every other year. So it's on the odd years. So 2025, February through June was the legislative session. This year it was the 83rd legislative session here in Nevada. So as you all probably know, this is probably repeat info for a lot of you, but I think it's helpful, just summary. Each legislator and the governor and some executive branches all can bring forward bill ideas, right? So there's a ton of bills that get thrown in the room. I think there was nearly like 900 this past year. Of those bills, there were 176 that had some sort of impact to Medicaid. Some of them were Medicaid specific bills, right? Helping us create this council was actually a bill during the legislative session. Other things had nothing to do with Medicaid necessarily, but they impacted our work. Right? There was some tangential impact of our work. So, for example, there was a ton of focus this year on prior authorization, right? Reforming how quickly insurance companies have to respond to requests for prior authorization and the information they provide, all that. That was really focused on the private insurance industry, but we have private insurers that provide Medicaid, and so it impacted Medicaid too. And so we were part of that. There was Medicaid implications, or there's impact to us from that bill. So of those 176 bills, we tracked them every single day when they went through the whole process. So there's kind of the journey. I don't know if you guys ever watched the Schoolhouse Rock video of how a bill becomes a law, but it's kind of like that, right? Like they start on one side of the chamber and they get heard and people like Bill share their support or their opposition to it. And then that first committee votes on it. It goes to the floor of the committee, either the Senate or the House and the Assembly, and they vote on whether it keeps moving forward. And so it keeps going through the whole process. So Medicaid's role in that, we were really closely involved. I was down at the legislature a lot of days of those 120 because we have to be in the room anytime one of those 176 bills is being heard. Wow. And that's because we are the technical experts on the Medicaid program, and we can get called up to answer questions about it that the legislators have. And so things like the MAC and BAC bill, there weren't a ton of questions. Melinda presented it. She did great. They said, that sounds important. We should do it, right?
That's right. I was like, okay, easy peasy.
Exactly. She did really well. But other things are a little bit more complicated. There was a bill about IVF for fertility treatment. And so there was a lot of questions about what does this mean for Medicaid, right? What would the cost be to the Medicaid program if this bill passes? And so what we do on our end is we develop what's called a fiscal note for every Medicaid bill. And that is our analysis internally of if this bill passes and becomes law as it's written, how much would it cost Medicaid to implement it, to make it part of our program, right? So there's an awesome team. We had probably 80 people working almost every day on these bills because we had a 48-hour turnaround from when we get the bill to when that fiscal note is due. And so it's kind of a really complicated thought exercise of like, how do you figure out how much it's going to cost us, for example, to add fertility treatment services, right? How many people do we expect would use them? How many people in Nevada are experiencing infertility, right? How many people, if they have the treatment, how often is that successful, right? How many cycles of IVF did they go through? How many new babies are going to be born in Nevada because of this? And what is the cost of their care on Medicaid, right? All those things we had to calculate to provide an estimate to the legislature because they need to decide. They have a very set budget. They have to decide how much it's going to cost. So we submitted, I think, 121 fiscal notes. Often for a single bill, there was 5 different fiscal notes because they keep revising it, right? They'd say, ooh, that seems pretty expensive. Maybe we don't want to do it all this way. Let's try to find a cheaper version of what this looks like. So we did a lot of fiscal notes there. The other way that we help is providing technical assistance on the bill language. So this is where I learned, Brooke, to your point about the formatting, because often they'd say, hey, how can we write this in a way that actually works best for the Medicaid program or aligns with the federal law? That's really the complicated part here, right? Is our legislature is really focused on this Nevada state law, but we're held to that Title 19 of the Social Security Act, our state plan. We can't do things that don't align with those federal pieces. So we worked really closely, for example, with Senator Taylor. We had meetings with her all session to figure out the right way to describe family caregiving in that bill that aligns with something the federal government will actually approve. Because we don't want to have a bill that says, hey, Nevada Medicaid, go ask permission to fund something that the federal government won't fund. That's not a good use of our time, but there's ways we can define it and describe it in a way that works. So there's a lot of technical assistance that we provide there throughout the process. And we go and answer questions and provide testimony and work behind the scenes just to make sure that folks have the information they need. Importantly, Medicaid is neutral on every bill, with the exception of our budget bill, right? The things that we ask for in our budget, right? So you won't see me up there testifying in support or opposition, but we'll get called up in neutral or during the bill hearing to say, hey, this is what it means for the Medicaid program. Whether we think it's a good thing or a bad thing, it doesn't really matter. We're just giving our technical understanding of what the bill is, right? So that's kind of our role in the legislative process. We have 43 total bills of the 176 that got whittled down to 43 that were passed and were signed by the governor and are now bills that we are implementing. So those 43 bills totally range. There's some things where it's like, add a link to information about lactation support and breastfeeding on your website. That's something we can do in probably a month, right? That's a pretty straightforward thing. There's other things like developing a new medical respite program. And that's allowing people who are experiencing homelessness, that are leaving a hospital setting, that aren't ready or not able to live safely on the streets. It provides a temporary short-term housing for them that gives them a lot of medical care. It's kind of like an in-between transitional housing that helps them stabilize their wounds or their treatment and make sure they're in a safe place to hopefully find more secure housing after that. So a medical respite program, super complicated to stand up. We have to ask the federal government to change the rules for what we pay for to add this new benefit. That probably takes 2 years. We need to figure out who can be a medical respite provider. What does that building need to look like to be safe? Who are the people that are working in that building and what are their qualifications, right? And then we need to figure out, what do we pay for it, right? Like, how much does it cost per night to provide this care? And how does Medicaid provide the reimbursement for those services, right? All those things mean that medical respite, that bill will probably take us 3 or 4 years to implement before it's fully in place, right? There's a huge range of how much work implementation is, and it touches almost every single team at Medicaid because everyone's now in charge of figuring out how do we make these new laws part of our program. And quite honestly, we'll probably still be working on some of those when the next legislative session comes, right? Like, we start prepping for the session about a year ahead of time in terms of submitting our budget and all that. So this group will play a really important role in our implementation because we're going to bring you some of these policy changes related to the bills to get your input on. So things like we're really trying to figure out how to change the way we pay for mobile crisis service. So for people experiencing a mental health crisis, the goal of the state is to deploy a mental health specific team to provide them care rather than sending an ambulance or a police or a fire team, right? But it's really hard to pay for that for someone that lives out in Ely or someone who lives in Tonopah, right? How do we figure out the right way to compensate for mobile crisis across the whole state of Nevada? So no matter where you live, you can get access to in-person mobile crisis response that you deserve, right? So we have some ideas, but we're gonna bring those to you and say, hey, here's a couple of different ideas we're thinking of. What do you think? If you have a family member, if you're experiencing a crisis, what would you want in this situation? And how can we find a way to make that happen, right? So that's one example. There's a lot of new services that we're developing. Like I mentioned, there's a fertility preservation one. So for people undergoing cancer treatment who the chemo would impact their ability to have kids, that's something we're helping to figure out how we can pay for services for that. There's a lot of kids related services, which is exciting, a lot of dental services, a lot of the family caregiving service. We have a new program for the elderly. There's a ton of new things, which is exciting. And it means that we need your input on it. So all that to say, I'm curious for those that were following the session or are curious, like, are there certain bills or topics in particular that you all would want to get an update on what we're doing in an implementation and have a chance to give some feedback?
Well, it's fine. Sorry, no, didn't forget to say Bill Sims for the record, but I actually that was the bill that I gave testimony on, was the IVF bill.
Oh, okay.
So,
Great. Yeah. So that the fertility preservation one. So for the record, the IVF specific bill was much broader, and that one did not end up passing. But the fertility preservation bill, that's a little bit narrower for people undergoing cancer treatment, that one did pass. So we'll be working on that one, and we can give an update on that. Absolutely. Yeah. Any others? Or general topics? You're like, was there a bill about this topic? You can ask us.
Is there a link that shows all the awesomeness you guys are doing with these bills, just so like we can look into like, you know, all the different things you guys have worked
Yeah.
on and yeah, can we get that?
Yeah, that's a great question, Brooke, and I appreciate your use of awesomeness. It's awesome. There's so much good work happening. So, yeah, we actually gave an update to like the broader public about what we're doing for implementation. I think it was 2 weeks ago, and all those info are posted online. So I'll ask that our back support team to send the link to that so you can take a look. There's some really good slides that show in behavioral health and medical services and pharmacy services, right? What are the bills that we're implementing and what does that look like? And so we'll share that with you all. And then if there's particular items within that you're interested in learning more on, we'd love to hear that from you and we can get those on deck to talk about in our next meeting. How's that sound?
That sounds great. Happy to be part of it.
Yay. Okay, great. Yeah, it was a great meeting. It was 3 hours long. So if you
2 hours.
2 hours. I talked fast, I promise. So you can watch the recording or you can look at the slides, but that's a really comprehensive update of not only what bills passed, but where we're currently at with the implementation. So
Great. And you said that was going to be emailed to us?
yes.
Or
Yep.
Send it out.
that would be
Yeah.
great.
Mhm.
That'd
Yep.
be great.
Yeah.
I do have, I guess off the top of my head, trying to, I'm hopefully if it's all right that I could come back to this for sure.
Mhm.
I've got sort of a chart going that I'd
Yeah.
love to be able to bring up. Thank you.
Yeah, please. Yeah. Send that to us over email, whichever ones you're interested in. There's certain bills that I'll tell you, like the update is there is no update yet, right? So for example, we have a new program for, it's called PACE, but it's provide more like comprehensive primary care services for seniors and people that are on Medicaid and Medicare, right? And it's to give them like a home, primary care home, where all their services are under one roof. Super helpful, but we have to get a vendor to help us even figure out how we then get vendors to do this, right? So it's like a 2-year process. So we're in the very early, very kind of boring contract phases of it. So we won't have a ton to get input on yet, but there's others that we're actually making policy decisions on right now. Like we have a new program called First Episode Psychosis. So it's for people that are in their late teens and early 20s that have an episode of psychosis for the first time with no other symptoms. There's a ton of really good clinical evidence of how to get them the right type of support right away that actually prevents it from ever happening again. They can really be benefited. And so we're trying to figure out, it's a grant funded program. We're trying to figure out how to pay for it in Medicaid. And that's something that we're working on in the next 2 months. So that's something we could probably bring to our November meeting, for example, right? So I think share anything that you all are interested in from that list that we'll share out over email. And then we'll let you know, let's talk about these 3 now. And those 3 we'll revisit in a couple months. Does that sound good?
Great.
Yeah.
In the chat, I also put the link to the legislative.
Oh, great. Thank you. Yeah. So we have a good webpage as well that had links to a lot of our presentations. So Stacy gave a lot of presentations on the budget and on the Nevada Health Authority. All of that info is in there as well. So I think maybe it'd be helpful for those that are in person, maybe all the links in the chat, we can assemble those and package them in the follow-up email as well. And we'll make sure everyone has access to all that.
Yes.
Yeah, please.
Azraella here. So the feedback or administrator's report in Northern Nevada, I was wondering if Medicaid is providing incentives for providers to come into their network and what that's going to look like, because as of now, my children are on emergency basis because there's not enough providers for our insurance. So my daughter, she's 10 and a half months and she's only been to the doctor 3 times. And every single time I go to make an appointment, they're canceling, saying that there's no available providers for my insurance. And so that's really frustrating to get her care.
Yeah, I'm really sorry to hear that. That's super frustrating. Yes, provider workforce, Nevada ranks 48th.
Yeah.
50 states
Really
in
low.
terms of having providers, right? So it's really challenging. And that's a real life example of what that feels like, right?
It
As a
feels
patient.
awful.
Yeah, it is. And your daughter deserves to be able to see a provider more quickly than that. So in the short term, let's talk afterwards. I'd love to hear which plan she's on and if we can figure out ways to support you on that. But I think more broadly, there is a lot of work on provider workforce that the legislature was focused on. So one of the big things is that graduate medical education in Nevada, meaning brand new doctors coming, getting trained in Nevada and staying in Nevada. It's really rare. There's not a lot of slots for doctors to come in. And so it's exciting. Melinda's team actually got a ton of funding. I think is it 16 million?
Yes,
16 million
16.
to support, this is Melinda Southard for the record, to support graduate medical education slots throughout Nevada, so north and south. We have a advisory committee that is going to convene here at the end of September to just, get the band back together and start talking about, what the graduate medical education program looks like in Nevada and how we can make it better. And trying to incentivize providers to come to our state and not only do their residency here, but to stay here and to work here and, work in rural Nevada and really serve our state more wholly. So, yeah.
And to interject,
Please.
as a pre-med student
Yeah.
at UNR, we are promised to stay in Nevada. We have to promise that we would stay in Nevada after our education is finished.
Okay. Wow.
So I don't know if that's new, but it definitely brings people here and hopefully helps them stay.
Yeah, absolutely. Thank
That's
you.
huge.
Mhm.
I'm so excited you're part of that program. That gives me a lot of hope. But so I think the G&E is a good example of some of the long game, right? We have to play the short game and the long game here. And so some of the short game things that were passed during session were really about increasing the rates that Medicaid pays for services, right? It's a simple economics, right? If you pay more for the services, you'll have more people providing them, right? There are a lot of providers in our state that are delivering care but are not enrolled in Medicaid. And so we're trying to also address that. We need more people to come to Nevada, and we need the people in Nevada to serve Medicaid, right? And so we're really looking at workforce from all of those angles. I'm super appreciative that we have a whole new workforce division and team that Melinda is working with. So a lot of those rate reforms we're trying to get in place like within the next few months because we recognize the need is immediate. We can't wait through a whole residency training process to have new providers too, right? We need to do both.
And sorry to interject.
No, please.
Azra Ella speaking. So going to the hospital is way more expensive than going to your primary care provider. And that's a massive increase in our budget. If we could offset that and have available providers for our patients, then we're going to save money.
You're speaking my language. Yeah. No, I'm a big believer. We need to make an investment in primary care, right? You have to start upstream and try to support people with those preventative services and on chronic disease management. We don't have to have everyone being treated in an ER or a hospital.
Right.
But unfortunately in this state, that's often what's happening because we don't have access to those upstream services. Everyone's stuck downstream, right? Yeah. So I really share that focus.
And in my field, a lot of the doctors that are going into the field or the new doctors, they're going into specializations. And so primary care is being overlooked. So if we provide incentives for primary care for them to start off really well, then they're more likely to choose that path.
Yeah. And Melinda Southard, to interject on that too, we have the Rural Health Transformation Program as a part of the One Big Beautiful Bill Act. It's a $50 billion grant nationally, right? So all 50 states are eligible to apply. Nevada will be submitting an application. I'm leading that charge. And one of the priorities of that is to look for creative ways to incentivize, primary care, maternal health, and behavioral health. So those are really the areas of focus that we're looking at right now. And we're just waiting on the application guidance from the federal government to be able to put that package together. But that is another program, that we're looking to launch here soon.
Yeah, Grace Larkins. Melinda, you said incentivize primary care, behavioral health, and what was the third?
Maternal health.
Maternal health, great. Just a couple of notes. In all of the research and the different groups that I've been working in, it always comes back to the workforce. Just exactly. So it's great to hear all of this conversation. The other question I have on the education support that you're working on, that those graduates is I find that PT, OT, speech therapy, we have a really critical shortage of those specific, particularly in Northern Nevada, but certainly statewide. And so those, as well as, the other area for that we see at the Family Navigation Network is obvious, and you've heard this many times, I'm sure, is getting assessments and diagnosis, within neurodevelopment and neuropsychs and behavioral. I mean, behavioral analysts, like in these areas, those are spaces where I feel like there's a lot of opportunity, and I'd love to see a lot of support. But I also think that the that education incentives, I'd love to see the physical therapy and occupational therapy be at least considered within that area as well.
Thank you for that consideration, for sure. Melinda Southard for the record. So with the graduate medical education program, this is a whole new area for me. So I'm doing my best to learn while I'm implementing and leading the program for the state. So I will take that into consideration and see what we can do there. Thank you.
Yeah, I think that aligns well with the rural health piece as well. So
Yeah.
I think what's helpful in all of the workforce conversations too, I'm so glad you raised this, and Azrael, you raised it as well. I think from the Medicaid perspective, we try to think through what are our tools in the toolbox where we can help, right? This is not a problem that Medicaid can solve on our own. And there's a lot of things that we need to partner with others that have different funding to help with, right? We can't provide education incentives or GME slots. But the state has provided that through other grants or through other agencies, and we can partner, right? But the Medicaid tools in the toolkit, I view as number one, our policy and state plan on who can provide services. So we really look at, are there services that we can broaden who's able to do it, right? Is it only MDs, or is it MDs and also physician assistants and nurse practitioners, right? Thinking about the mid-levels, what are the appropriate providers to ensure the services are delivered appropriately, but also that we have enough providers to do it. So that's one angle we can look at. And then the other big tool in our toolbox is how we paid for it, right? So really thinking about, for example, occupational therapy, we just did a rate increase. We just said, hey, we actually believe we're not paying enough for occupational therapy. We have some funding to increase it, but we're not going to do it across the board everywhere. We're going to really focus it for in-home therapy and for rural areas. So there was a 10% increase, I think it's 10% increase for all occupational therapy services, but for services delivered in a patient's home, they got an extra 5% bonus. They got an extra 5% increase to their pay.
On top of the 10?
And then if it was delivered in a rural area, that's another 5% add-on, right? And we're doing that for behavioral health too. We're saying, hey, we recognize the way we pay for things can help drive where the providers actually are. So we're going to pay more for services in rural areas, services delivered at home, because we want to see more of those providers out there in those areas. So that's those are two of the tools that we think of, because sometimes I'll admit it feels daunting. Like, how can Medicaid ever solve the challenge of us not having enough providers? And we can't do it alone, but we do have some really powerful tools that we're looking at to try to improve it.
Grace Larkins, for the record, just I'm curious on the BAC and the MAC, do we have representation from the rurals? Pretty good, or any?
Currently, we are, I think we're mostly Washoe, Clark, as of right now. We do
I'm
want to
considered
try to-
Carson.
Yeah.
So rural.
Yeah, right. Yeah. And so we do want to get more rural representation. We really tried hard to get that with the applications that we received. However, we didn't get that money, unfortunately, but we hope to, make that happen as we go. But we did, pull demographics of the Medicaid recipients that we serve to try to reflect the makeup of the council.
Sure.
With selecting people as well. So hope to have some more rural representation, in the more or frontier, locations throughout Nevada too. These are huge issues there.
There one potential approach on that. Another acronym, but you had mentioned PACE, but this is different PACE, the PACE Coalition for the Elko County area. There's a couple of those sort of hub organizations in the rurals. I know that I attend at least the one that's up here for the Northern Nevada rurals. So we could maybe have a check-in on there, posting sort of some relevant once we are at that point where we maybe want to identify like some key sort of questions or things that we might want to ask to just kind of put them out there on those like larger channels.
Sure. Yeah. Tap into existing forums. That's a smart idea. Yeah. Absolutely.
I do want to give an opportunity for those online to jump in, but I do also want to keep time in mind. We do only have an hour and 5 minutes left. And of course, we definitely want to have more discussion, but we do have a couple of other agenda items that we need to go through. And I also forgot to say Nahibi for the record. Brooke, Kaylani, do you guys have any comment on the discussion? Otherwise, we can kind of keep going.
No, I'm just listening in. I definitely would love to get that link as far as the policies to kind of look into for the next time. So I am able to kind of sit down and be more prepared.
Absolutely. Yeah, we'll make sure you have that link, Kaylani. That'd be great.
I have a question. I'm not sure. I know with Health Plan of Nevada, they have something called Now Clinic, which is like an app that you can go on for non-emergency, things that you wouldn't need to be seen in person by a doctor for. Is that something that's offered by primary care physicians? And if not, then, obviously for similar situations that you wouldn't need to go into the office for, I'm sure that, they'd be happy not to be in physical contact with so many people and have to worry about getting sick if it's not totally necessary, if that's not something that's already a thing.
Yeah. No, Brooke, that's a great thing to flag. That in the Medicaid world, this is again Medicaid lingo. We call that telehealth, which you probably heard that word a lot during COVID, right? This was something that was super rare, quite honestly, until COVID hit, and then suddenly everyone is needing to do telehealth, and we have to figure it out, right? So the good news while it was many challenging parts of the pandemic, is it really required us to think differently about how Medicaid pays for telehealth services. And so we do have reimbursement for those types of virtual services in a way that we didn't before. So for example, Brooke, a primary care provider could deliver a visit over telehealth, over the phone or over video, and get reimbursement from that through Medicaid. There's a lot of rules around it and what it looks like. So I think there's probably some areas of opportunity or clarity that we can look into there. But that is something, as a result of COVID, that is a lot more feasible within the federal Medicaid program. The whole US government made a lot of changes to make that happen. But those apps often are another great way to do it. And I'm really glad that you have access to that through HPN. I've heard that can be really useful as well.
Actually just the Medicaid app in general, for those that don't have it downloaded, has a treasure trove of resources on there, regardless of who your provider is. So yeah, for those that don't have it downloaded, I've had it on my phone for a few years now. I would definitely check it out.
That's great. I'm so glad to hear it's been helpful to you. And that's something that we'll bring to this council, as well as like, how do we communicate with our Medicaid recipients better, right? We recognize everyone uses their phones differently and everyone uses the internet differently. Like, how can we try to meet everyone where they are and give information in a really clear way? So I'm super glad to hear the app is helpful to you. And we want to continue to make it that way. So if you have recommendations, we'd love to hear them. All right, I think we'll close the legislative part of this. Then we will share the list of the policies that we're implementing, so that way you can take a look. And if there's ones in particular you want to hear about, we'll keep this one on the list for a lot of items moving forward. So I'll give two perhaps quicker updates, but I'd really love to get some feedback on our statewide managed care transition. So as I mentioned, January 1st, about 70,000 people in our rural counties will be transitioning from fee-for-service Medicaid to managed care. In those rural areas, we have two managed care companies, Silver Summit and CareSource, which is a nonprofit plan that's new to the state of Nevada. That will be those available providers. So we'll be assigning patients to those providers in the rural areas, and people in the urban areas may get assigned to a new health plan based on the distribution of who got the contract, right? Because every 4 years in Nevada, we go through a new contracting process where the managed care organizations have to bid and say, hey, I want to participate in this. There is a panel that evaluates those bids, and then a contract is awarded. And so all of the previous managed care organizations are returning, but the counties they're in may have shifted. And so there is some shift in what that looks like. So on January 1st, those new assignments will be made, but we'll have a 90-day window for people that can switch plans after that time if they'd like to make that change. And so one thing that I'd really love to get feedback from you all, whether or not you will be directly impacted by this change, and we can talk about it if you're curious, if you are, how would you want to hear that information, right? How can we communicate to our members in our rural areas and also in Washoe and Clark about these changes? Because we know no one wants to be surprised on January 1st, right?
Yeah.
That things have changed. So what are your recommendations for us and our team on how best we should be communicating about these changes? Anything come to mind first?
Bill Sims for record, I would say the best, most common way is email.
Okay.
Because whether you don't really use a phone, most people do use a laptop, tablet, computer, something that can get them their email address. So I would just think like that would be their first channel to go with, because I know like you can also text and do phone calls, but people just may not want to, like, I know a lot of people nowadays don't like to be on the phone.
Yep.
So I would just think like probably email would be the first best
Yeah.
option, I would think, but that's just me.
Yeah.
Become a millennial, but
No, but that's what counts, right? We want to make sure that you and folks that have that same preference are getting it over email and get that information. If you were to look at your email and you get an email from Nevada Medicaid or from, I know that you're not on a managed care plan, but pretend you were, if HBN, whose email would you open first? Right? Who should it come from? What's your
I would
recommendation?
think the second one, just because if that's who people know, because that's what's on their Medicaid card, then I would think that would just be like, okay, if it's coming directly from their insured with Medicaid, then they're probably just like, okay, cool, I know that. And then, because like I would think of it like you're getting from Medicaid first, you're kind of like, well, why am I getting it from Medicaid? Medicaid instead of an actual carrier with Medicaid.
Yeah.
So.
That's great feedback. I appreciate that. Yeah.
And I think.
I heard you, Brooke. Yeah, go ahead.
Yeah. So again, kind of going back to the Medicaid app, the email thing is a great idea. I think it would be awesome if, there was like a push notification if you had the Medicaid app that popped up on your phone. You don't even have to open it. Like, hey, we're going to switch you. Because this is something I have personal experience with. Unfortunately, when Molina got contracted with you guys, I got switched over to them, and it seemed like it was like I got whiplash from it. Like my prescriptions were all messed up, and I mean, luckily there is however much time you have to switch back. But I mean, Molina wasn't contracted with Southwest Medical Associates, which is who I use, and it was so much chaos, and it was like, if it would have been so much easier if there was just like a little pop-up like, hey, we're about to, switch you up, or you have a choice in it somehow, or, it would have made things a lot easier.
Yeah. No, I'm sorry to hear that was such a hard transition, Brooke. But I really appreciate you sharing that feedback. It can be really hard, right? Those things that you're mentioning, prescriptions and your primary care provider, there's a lot of logistics and details involved in it. And so try to be as proactive as we can, and also support patients throughout the full process. We do actually have a 6-month care transition period. So when you get assigned to a new plan, they're required to honor what your old plan was paying for that time period. So that we're doing a lot to try to ensure that that is less painful, because we've learned a lot from what those transitions have looked like. But I think that communication, and I love the idea of a push notification on the app. We can take that to our app team. I have no idea technically if that's possible, but I will ask because I think that's a great idea.
Bill Sims for the record. I just had a question on that. So in regards to when people are being transitioned into these new plans, and they had to the other services have to be honored for that 6 months, will there be anyone there to kind of help them along with while they're having to honor those services, that when they're being spliced over to the new plans permanently, that someone will be there to help them find those services with the new plan, or they're just gonna have to do it on their own?
No, it's a great question. So there will be someone. So the goal of a managed care plan is to provide care coordination services. One of the main goals is to provide care coordination services to recipients that Medicaid, the state doesn't have the staff or funding to be able to do, right? So the health plan actually hires a whole team of people across the whole state of Nevada to provide these types of very services. Say, hey, I'm going to get on the phone with you and we're going to call a doctor to help get access for this particular, you need to go see a podiatrist. Like, here's 5 podiatrists that are networked. Let's give them a call and see if we can get an appointment scheduled. So every patient in our managed care plan should have access to a care coordinator that will help them with that. We recognize that hasn't always worked as well as people would hope. Like, it's not perfect, but we're trying to ensure that it works and that people get that support, especially in that transition period. It's really crucial. So both the old plans are giving all that care coordination information to the new plans. And that new plan then can pull up that patient's information and they have a whole record that's been transferred. We're working on the back end transfer right now. So that way they can pull up the information and figure out what that patient has been getting and how to support them moving forward. Yeah, great question. Yeah, Brett?
I wanted to add one more thing. So like WIC offers, new mothers like formula and stuff like that. I think it would be really cool if Medicaid, and I think some insurance groups, or depending who you're insured by, like you could get like a monthly card, almost like an EBT card or something for, to be able to buy like Band-Aids or just different, medical necessities that, you might not have cash for, or, that kind of thing would be really cool.
Yeah. No, thank you, Brooke. That's exactly right. So each of those plans have their own types of benefits that they give. So like you mentioned, sometimes it's like an EBT card or a Visa gift card that you get for a quarter, for a month. Others, it's things like a Sam's Club membership, as you mentioned earlier, right? It looks a little bit different. And with the new plans, they're going to have new offerings. And so what we're trying to do is also make it clear to patients what those are, right? If one of those offerings is really going to help you or help address something that you're looking for support on, then we want to make sure you know that so then you can help pick that plan that's going to help you best, right? So that's something that we can, we're trying to communicate throughout this transition process of exactly what those benefits are.
So it seems like a lot of benefits, like maybe aren't necessarily like generalized, but like are left up to whoever your insurance provider is to delegate those out.
That's a great question. Yeah. So the things that I had shared on the slides about mandatory and optional benefits, whatever Nevada puts in our state plan, every single payer, every single carrier, every single managed care plan has to provide those, right? That's the base level. That's basic, right? It's their choice if they want to use their money to pay for things beyond that, right? So that's what the things you're talking about that are more custom to every plan. That's kind of the bonus, the add-on stuff. But the basics, so every single plan, well, no matter what plan you're on, you'd have access to the exact same services. Does that help make sense?
Yeah. Yep. Gotcha.
Yeah, that's a great question, Brett.
Okay, so I wanted to say I'm really excited for CareSource, and I'm really happy that Nevada Medicaid has that managed care contract. I would say for me, as a recipient, I would love to receive notification changes through the mail. I think we live in a day and age where we get so many spam emails and spam calls. It's hard to regulate and kind of filter out what calls and emails are important. So I would really prefer to just get it in the mail. That way I'm alert and aware and I'm able to pay a little bit more attention versus just kind of via email or phone call.
Yeah. No, thanks, Kaylani. That's a great point. I moved to Nevada last year, right before the election, or some before the election, and I was shocked at the number of texts and calls that we were getting, right? It was just so crazy. And that's the case, I know, for everyone here. It's a lot harder often. If you don't recognize that number, you're probably going to delete it because so often it's a spam. So I think the mail is another great angle, something that we've always done, but I think there's also ways we can make the mail maybe more appealing so folks open it, or make it a flyer versus a letter, right? There's different ways we can think about it, but that's really helpful feedback. And I'm right there with you.
Yes. Yeah. If it could say maybe urgent or something on there, something to kind of notate importance would be really preferred. And I understand some people opt out of physical mail for whatever reason. So the people that are opting out would be able to receive this information in another way.
Yeah. That's a great idea. That's a great idea. I think one thing that we can bring to future meetings would be show you guys some sample materials of notifications that we're sending or that our managed care partners are sending and get your feedback on it, right? Like, does this communicate that it's urgent enough, right? Like, do we need that font to be a little bigger to make it feel a little more intense? So I really appreciate that feedback, and we'll pass it on to the team, and then we can figure out which things would be coming out after our next meeting, and we can figure out how to share that there. That's great.
Actually, one piece of this committee includes all of the managed care organizations have to bring all of their marketing materials to this committee to get feedback on. And so that is something that we'll have at a future meeting as well. I think they just did it at what our committee was previously at the Medical Care Advisory Committee. Now it's turned into the Medicaid Advisory Committee. That is something that they did earlier this year, and that we'll probably have again next year. As well as the Medicaid Reinvestment Advisory Committee, which requires the managed care organizations to reinvest some of their funds or their profits in our communities, right? And for example, some of those are the gift cards that you see or memberships, I think. And then sometimes they do events like, diaper banks and things like that. So those are some other things that, and the managed care organizations will have a representative at our Medicaid Advisory Committee. We'll have a representative from each of the managed care organizations on those meetings as well, so that they could hear this feedback as well. So
Great.
Please, yeah.
Grace Larkins here. 3 just quick thoughts. One, the notifications that, are being looked at or that have been used in the past, what that messaging is, how simple, plain, your plan may be changing, and like as simple as that can be. I think another good place for that message to be put out there is where we have more often have the direct contact with maybe the providers or the hospitals, that's sort of just a public awareness piece of like that little message put out there and among providers. Second, the app that y'all are speaking about, I'm not sure if you're talking about those specifically for MCOs, so I don't want to say this out of place, but something I think is important. The Medicaid portal, or at one point somebody from within Medicaid was talking about an actual Medicaid app that we could use on the phone. But either way, that is not available for minors. Like, I don't have access to one for my daughter because she's under 18. And that is a really big hurdle. It's a big barrier for our families. So I'd love to see, that looked at. And then third, I guess my question is on previous outreach approaches that y'all have done, is there data on where it was, people were successfully reached in receiving that information? And also, is there a department or person or place that data has maybe, is it tracked where things were bounced back, right? Or that, email addresses that bounced back, snail mail that came back, wrong phone numbers, that kind of thing, just to kind of avoid any unnecessary stuff. I don't know if there's
Yeah, that's a great question. I think because it's the challenge here is we're communicating with patients, and then our MCOs are too, and we all have different contact information that we're getting at different times. And so finding a universal, most accurate list of, we think this is the most up-to-date information on their address and phone number, et cetera, that's a real challenge. And we, I think, are trying to develop a better system on the back end. When people enroll in Medicaid, we can talk about this when it comes soon. So this is a sneak preview. But next summer, we're going to do something called the Medicaid Express, where you can go online and many people will be able to enroll directly in Medicaid without ever having to go into an office and meet with folks or hop on the phone call. You're able to upload your documentation and fill out survey questions, all of that fully online. And that is also where you can update your address and phone number, and that will be a more universal source of truth for all the contact information, because we recognize we don't always have the most accurate info, and that's a huge barrier, right? If you've moved or if your phone number changed and we can't get a hold of you, that's on us. We have to figure out the right way to get that information. So I appreciate you raising that. And I think we should ask when the managed care organizations come with their materials to also bring the data that they track on their end about what that success rate has looked like or where they've identified opportunities to improve. So that's a great question.
Kaylin, you mentioned that That will be so helpful.
For the online enrollment, Kaylani?
Yes, yeah, I think that will just make it a lot more accessible for many people, especially people who have issues with transportation or disability, things like that.
Yeah, no, absolutely. I'm super excited. This is a game changer, and it's also going to help connect to SNAP and WIC and other benefits as well. And it'll also connect to the exchange. So if for some reason someone is not eligible for Medicaid, but they are eligible for a plan on the exchange, they can go directly there as well. So it's super exciting. It's a huge project, and we'll make sure that the team that's leading that can come share some updates with you all as it gets a bit closer.
Azraella, so this transition will actually affect my family. I'm currently on fee for
Fee-for-service.
fee-for-service.
Yeah.
And we're in the confidential address program. And the reason why we were on the FFP was because the confidential address program locates us in rural Carson City. And so when we transition into a paid membership through a insurance company, it's going to be a very big transition for us. I agree with Kaylani on the mail and maybe marking it urgent. The other thing that I suggest is notifying welfare office and also having direct communication with the welfare office, having updates with the clients or Medicaid recipients with updated information on their address. They will probably have the most updated information at the welfare office because we have to renew our applications every 6 months. And we also are required by law to update welfare office with any new information regarding our phone number, where we live, our income, all those restrictions. So having a direct communication with the welfare office or the human the health services, and having maybe them send a letter through to the recipients will also probably help
And Bill Sims, for the record, just to go on top of that, because, you know, I'm also on EBT and everything, so I get stuff from welfare all the time. And I would just say that if you're gonna go that route with welfare, have them make it as short, sweet, to the point as possible, because the one thing I always notice about whenever I get something from welfare regarding my eligibility and doing my recertification, it's always about 5 pages long. And I always have to go to the 4th page to start looking for what I actually need.
Yep.
So like, you know, if there, and I mean, like, I know there are state laws and everything, but it's like, if you are able to just make it as short, sweet, to the point as possible, then yeah, just say, hey, here's everything that you need to know. That's it. Like, don't add anything that isn't necessary.
No more than 1 page.
Yes.
Yeah, 100%.
And for welfare recipients that also receive Medicaid, transitional housing, all of those demographics are included. So to transitional housing, homeless people, they're more likely to go to the welfare office than the Medicaid office because it's
For sure.
closer or more well-known to have access to a lot of different services. So maybe working with the welfare office.
Yeah, it's a great suggestion. Thank you.
This is Brooke. I just wanted to say, like, for people, I understand mail might like be better for some people, but for, you know, the homeless community or whatever, people who would, I know a lot of Medicaid recipients get like a phone from their insurance provider, so they can let them know, you know, maybe if there was some way that they could, I don't know how exactly that works, but if they could send them, you know, I would assume that they would have their contact information and they could let them know, like, obviously if they're paying your phone bill, they would be able to get a message through to you that, you know, you're about to be cut off or, you know, some kind of thing like that.
That's a great point, Brooke. Yeah, absolutely. I think what we're hearing is all the channels, right? It's going to look different. Every single person will have different ways that they prefer to receive information. And so finding how to ask people what that preference is on the front end, right? On that online form, we should say, hey, how do you want to receive email communication? Email, phone, text, all of the above, male, all of the above. And if we don't know the preference, then use all the channels that we have when it's something this critical. We don't want to flood people with unnecessary information, but this is really important. To your point, for your family, this will be a big transition. We want to make sure it's a smooth one. So I appreciate that, all that feedback, but we'll communicate that. We have a weekly stand-up with all the teams and the managed care organizations planning for this transition. So I'll bring this feedback back to them. It's very helpful. Please.
Yeah, Grace Larkins, just one final thing on this Medicaid Express, which sounds fantastic. I just wanted to, make sure that that would also be available for minors.
Yeah. Yes, that's a great flag in terms of access. And on the app piece, I wrote that down. I want to do some research there as well.
Thanks.
But it's a good point, right? How do we ensure there's levels that a family member, caregiver could complete it themselves, or for the recipient who is a minor to complete it themselves as well? We'll need probably both options.
Right.
So that's really crucial. Yeah.
Right. I think overall something with this with BAC and MAC, something that I've been thinking about ever since I applied as a primary piece to me is related to portals in general. Not like the recipient portal, also, the provider portal, how there's been all related to pre-auths as well, how there's really supposed to be this like really open and transparency and interaction that happens really quickly between the parties, between Medicaid and between the providers, and then and what we've seen in practice is that not actually quite doing that, but seems like that is a place where like so much streamlining and communication improvement and stuff could really have an impact.
Yeah. Yeah. So a lot of bills related to that as well. So, and we have a whole PA standardization process going on. So that's a great thing for us to put a pin in and give some updates on next week. Yeah, that's great. All right. I know we're getting close on time, so I'm going to just tease my third item and we'll talk more about it in our next meeting as well. But our children's behavioral health transformation. So this is our other really big project right now. As folks may or may not know, Nevada was actually found to be out of compliance with the Americans with Disabilities Act by the U.S. Department of Justice. So what the Department of Justice does is they do investigations into all the states to make sure that federal laws are being upheld. And they found that Nevada was in violation of the ADA, particularly a particular provision of it called the Olmstead provision. And what that means is that people have a right to live at home and in their community whenever possible, given their disability. So for this particular finding, they found that kids with behavioral health disabilities were being institutionalized, meaning the care they were receiving was primarily in hospitals or residential treatment, and they didn't have enough access to home or community-based treatment to get the care that they need. And that is in violation of federal law. So earlier this year, the state reached a settlement agreement with the Department of Justice with it's 147, I think, items that the state will do to come into compliance with the Americans with Disabilities Act. And what that really means is the state is going to develop more home and community-based behavioral health benefits to help keep kids at home and in their communities and get the care they need across all the different systems they're involved in and all the different providers they're seeing. And so this is a long game effort, right? We are working on this we will be working on this for decades to come. But I'm really excited. We've made a lot of progress in a short year. And so I would love to give some updates to you all on what that work is, what we're doing. And I will also flag if you're interested in participating and learning more about what are those home and community-based benefits, right? What behavioral health services are we paying for? What does this look and feel like to our recipients, right? We have a working group that meets virtually every month. Our next meeting is this Thursday, and you're welcome to join. Anyone from the public can join. I know you have a lot of meetings with us this week, so no pressure. All of them are also recorded, and that's all on our website. We'll make sure our website's included in the follow-up items as well. But our goal is really that working group is made up of representatives of youth members. We have some high school students and youth members. We have parents, biological parents, foster parents, adoptive parents that have kids with behavioral health disabilities that they're caring for, as well as providers across the whole behavioral health spectrum. And our goal is to get input on how do we design a specialty managed care plan. So a specific health plan that's just for these kids, that's designed to give them the support that they need. So our conversation, we're having a whole deep dive with just parents and youth next month about peer coordination, right? What should that feel like if you're a youth or family member with a behavioral health disability, and how do you navigate all of our systems in Nevada? How can we make that better? So we're having a whole dedicated conversation kind of like this with those folks. And so if that's of interest to you, we'd love to have you join those working groups, but know that I will be joining, of course, all of these meetings and giving you updates on that work. The plan is for that new specialty managed care plan to go live on January 1st, 2027. So in about a year and a half. So we're starting the whole process to get a new payer to bid on it, right? It's a whole long multi-year process that we're right in the middle of right now. So know that that's going to be ongoing. And if you have any questions on that, I'm happy to answer those today.
That's tomorrow.
Thursday. Thursday is tomorrow. Yeah. Thank you. Yeah. Wow. I thought it was Tuesday. Yes, that is tomorrow. Oh my goodness. Yes. Thursday. Yes, it is tomorrow at 4:30 p.m. And our website is, if you just Google Kids Behavioral Health in Nevada Medicaid, our website will be the first thing that pops up, and you'll be able to see all the information there too.
And that website's in the.
Thank you, Minden. I appreciate that. Yeah.
Azraella, I think two great avenues that we could look at for Northern Nevada, I'm not sure about Southern Nevada, would be Eddie House and also Boys and Girls Club. Boys and Girls Club would really love our kids, and they're willing to work with kids with special needs.
Yeah.
And especially on behavioral health. When I worked at Boys and Girls Club, we had people or like teens or young people that would like run away, and the parents would come to Boys and Girls Club first, asking where they were.
Yeah.
So having a really good community support group, such as Boys and Girls Club or Eddie House, I think that's really should be a priority for Medicaid.
Yeah, thank you for that suggestion. I think that's spot on. And the way that we're hoping to design that specialty plan is that the care coordination people get is not from someone who works for the health plan, but it's for local care management organizations that are nonprofits or community organizations that are in our communities that would be providing that care coordination service to the kids. Because we recognize there's a lot of people that folks already have a lot of trust and familiarity with. Boys and Girls Club is a great one. The president of Nevada Boys and Girls Club is actually on our working group, and she's awesome and gives us a lot of input. And that's often the most trusted person in that family's life. And there's no need to add someone else to that mix when they already have a great entity doing it. So we're trying to figure out how can we support Boys and Girls Club, for example, in providing care coordination services and hiring the people they need to do that as part of that plan. So thank you for that suggestion. Good. I've heard great things about the Eddie House as well, and that I don't know that they're as engaged in it yet, and so we should. So that's a really good piece of suggestion for us.
Right. When they're not at the Boys and Girls Club, that's the next place would be the Eddie House that they would look at. So putting that on our priority list should be important.
That's great feedback.
Great.
Thank you.
Grace Larkins here. I just want to say this is huge, and this is amazing that there is such an effort being put here. There's a great needs. It's very exciting. Something to keep an eye on, I think, is that transition point when they enter adulthood. A lot of people and families feel like they're just really put up to pasture. Is that the phrase? When they hit that point where their kid hits 18 or ages out of school. Just something to framed.
Young adult transition is so key. As part of our work, we will be it's for kids ages 0 to 20 to try to extend beyond that 18 transitional period. But because of the federal guidelines on what the definition of adult is, age 21 is no longer part of their plan. So we really need to figure out when someone is turning 21, what does that transition look like, right? That's a really challenging time of life often. And how do we support them in that? I will note for kids that were part of our foster system that have aged out of foster care, they have coverage until they're turned 26 in our state. So it's a little bit longer, which is great, but still same thing. When you turn 27, what does that transition look like and how can we better support there? So thank you for flagging that. Something that we have on our radar, but haven't gotten into the details of enough. And so we'd love to bring that maybe to this group and get some feedback on how we can do that. Right.
Great. So we do have at the Nevada Center for Excellence in Disabilities has a transition specialist. So that might be somebody to keep in mind at that point.
Yeah. Great suggestion. Absolutely.
Azraella, to add on to the foster care, does Medicaid offer foster care services and helping transition mothers giving their children or their infants away?
Yeah, so Medicaid, we don't directly offer foster care services, but we partner with the Child and Family Services Agency. It's called DCFS, Division of Child and Family Services. That's a statewide agency. And then Washoe County and Clark County run their own foster care program. So we partner with all three of those groups because every kid on foster care in the state is eligible for Medicaid. So we are really closely involved in that way. But in terms of that direct transition process, particularly when a parent is given custody to the state, that would be handled by either the county or the state on that end. And then they work with us to get those kids enrolled or those infants enrolled right away so they can get access to the care they need.
Because I'm asking because during COVID, there was no access to that transition process to help children in need go into foster care. Even if there was an application applied, there was no response. I'm not sure if it was because of COVID, but if Medicaid could work more closely with getting those children the access they need, or the babies, you know, into the care that they need, it could really alleviate maybe future behavioral issues later on.
Yeah, absolutely. No, I really appreciate that. This children's behavioral health work is so crucial that we partner really closely with foster care. And that's a great example of a particular point in the foster care kind of life cycle that we could probably get a little bit closer to that team on. So thank you for that suggestion. We'll take that back to our team.
Thank you.
Yeah, of course. All right. Thank you guys for letting me share all my favorite topics. I was really excited to talk about all three of those with you. And I appreciate there's a lot of the input and discussion has been really encouraging and helpful. And I'm excited to bring this back to our team. So with that, I'll turn it over to you all.
And we'll be bringing those, points that we've talked about or those topics that we brought up to our Medicaid Advisory Committee meeting later today. So we can have another opportunity to discuss some of these things. But I do want to move on to a couple of other agenda items. So first we have our discussion of the BAC bylaws, and I might skim through these, but we did want to kind of go through them and get any feedback, and then possibly move on to our next agenda item, which is the opportunity to vote on these. And so really quickly, we want to get any feedback on these and see if there's any updates that you guys feel are needed on these, as these are going to be kind of the bylaws that we follow, right, for this council. And so first, the first section, I'll probably go through a couple sections and then we'll kind of do any questions or suggestions at the end. So the first one is the creation. So the Nevada Medicaid Beneficiary Advisory Council is created within the Nevada Health Authority pursuant to the Code of Federal Regulations. This federal law requires all state Medicaid agencies to establish a council made up of current and former Medicaid members, their family members, and caregivers to advise the state Medicaid agency on matters concerning policy development and the effective administration of the Medicaid program. The purpose of this committee is to advise the Medicaid Advisory Committee regarding their experience with the Nevada Medicaid program or matters of concern related to policy development and matters related to the effective administration of the Nevada Medicaid program, including the ability of beneficiaries to access covered services to improve access to care, quality, and health outcomes, and better promote health equity for Medicaid beneficiaries. Any questions on those two so far? As for the membership of this council, the BAC is comprised of the following members: a member of the Nevada Medicaid Division's executive leadership, individuals with Medicaid lived experience defined as current or previous recipients of Medicaid, or individuals with direct experience supporting recipients of Medicaid, in an amount equal to the number of individuals necessary to comprise a minimum of 25% of the total voting membership of, and who must concurrently serve on the division's Medicaid Advisory Committee. So this is at least 2 current recipients of Nevada Medicaid and at least 2 individuals with Medicaid lived experience, including those who have previously received Medicaid benefits or have cared for individuals receiving Medicaid. The terms include the BAC members will be appointed by the director of the Nevada Health Authority to serve a term of 2 years, which may not be immediately followed by a consecutive term by the same member. And BAC members will be appointed on a rotating and continuing basis. Any questions on that? Okay. The selection process is the BAC members will be selected through an application process that you guys all went through. This process will be posted publicly on the Beneficiary Advisory Council page, which is the BAC page. This is our recruitment policy. It is posted publicly on there. if you are ever curious about what that full process looks like. And the membership responsibilities include participating in these quarterly BAC meetings, either in person or virtually, participating in discussions and providing feedback regarding the impact of Medicaid policy and administration on Medicaid beneficiaries, putting forth agenda items for discussions such as access to care, communication, and other issues impacting health outcomes, provide feedback for the Director of Nevada Health Authority and the Administrator of the Nevada Medicaid Division from perspective of the Medicaid beneficiary, and a number of BAC members equal to 25% of the Medicaid Advisory Committee membership who will simultaneously serve on the MAC. And then this section goes over compensation. Except for those members of the BAC that are Medicaid recipients, members serve without compensation. If engaged in the business of the BAC, members are entitled to the per diem allowance and travel expenses provided for state officers and employees generally. Members of the BAC who are recipients of Medicaid are entitled to receive compensation while engaged in the business of the BAC. These members will receive a stipend of $75 per BAC meeting and $75 per MAC meeting for those members serving on both the BAC and the MAC. Individual BAC members are responsible for reporting the stipend as income when filing their taxes. It is also important that BAC members ensure the stipend does not impact their eligibility for Medicaid and other means-tested programs. And that is our bylaws. Do we have any feedback or any added discussion on any of the bylaws?
Question. Azraella, members serve without compensation. What does that mean? You guys are just getting paid because you're in the state of Nevada employment, or?
So members, council members on the council will serve without compensation unless they are a Medicaid, current Medicaid recipient. That's what that means there.
Okay.
Does that help? Yes. Okay.
The way the per diem rates are in, you have them in this.
Yes, we do.
Just FYI.
Yeah. Yes.
Okay.
Yeah. Any questions from? Yeah.
I have a
Right.
question for the vice chair and the main chair thing that you guys are doing nominations for. Are those going to be the individuals that are going to be chosen to participate on both the BAC and the MAC, or is that something separate?
So right now they are separate. So just because you are the chair of the Beneficiary Advisory Council, it doesn't necessarily mean you will also serve on the Medicaid Advisory Committee. We have asked a few members to serve on that committee already. But yeah, it doesn't necessarily mean you will serve on both committees, if that makes sense.
I don't know,
Monica.
maybe my...
Yes. Brooke, go ahead.
I was referring to like the positions for the vice, oh my gosh, I can't remember what it's called. That you email for the nominations for, is that part of being, having that position that you'll participate in both meetings or no?
So no, there is a chair and a vice chair for this council, the Beneficiary Advisory Council, and there will also be a chair and vice chair for the Medicaid Advisory Committee. They are two separate committees or advisory groups. And just because you serve on if you were to serve as the Beneficiary Advisory Council chair or vice chair, you wouldn't necessarily also serve on the Medicaid Advisory Committee as a BAC member. Or as a chair or vice chair on that committee, and vice versa.
Okay, yeah. Perfect. That answers it. Thank you.
Yes. Monica, I see your hand up.
Thank you, Nahibi. Monica Schiffer for the record. Just for future as we're going through, and if you folks enjoy your work on this council and are interested in applying again once your term is over and you have the ability to apply again, the Beneficiary Advisory Council members who are also serving on the Medicaid Advisory Committee indicated that in their application, and so that was part of their interview process. So those people who are serving on both, that is how that happened. So I hope that also helps clarify.
Thank you, Monica. Any other questions, Brooke, Kaylani? or discussion?
At this time.
I had like shown interest in, wanting to participate in both committees, but was told that like you guys had an interview and, weren't sure, but I said I would sit in on it anyways. And I got the information, thanks to Erica for that. But so with whom was just speaking, you're saying that those have already been chosen, or I don't know, maybe I'm just confused.
Monica, do
Thank
you want
you
to
for that continued question, Brooke. This is Monica Schiffer. So it could have been that those positions, because there's a certain amount of positions on each advisory council and committee. So it could have been that those vacancies or those positions, that wouldn't have been a vacancy since this is a new council and committee, were already filled. And so if you had indicated interest for both, and we no longer had a spot available due to them already having people be appointed in there, we did do several rounds of advertisements and recruitments for both of these. So it could have been that somebody on who had seen this information previously was already appointed there. However, just like this council, the Medicaid Advisory Committee is also going to have 2-year, well, 1 or 2-year appointments for this initial. Moving forward, there will be 2-year appointments. So there will be ample opportunity for folks who are interested to also apply for those moving forward.
And regardless if you were, not appointed to be participating in both, anyone and even people not on the committee, like from the public, can sit in on
Absolutely.
on these, right? Okay.
Yes, absolutely. They're all public meetings, and there will be public comment periods during both the BAC and the MAC. So you'll have opportunity to participate in that way if you are not a council member on both.
Thank you.
Thank you so much for the questions.
Any other questions or discussion before we move on to our next agenda item? Okay, seeing none. If there are no suggested updates to the bylaws and the members want to vote to adapt the bylaws, on our next agenda item, which is the action to vote on the bylaws, we can accept a motion to adopt the bylaws as written. Would anyone like to make a motion?
I can make a motion for that.
Okay, Ann Jensen making the motion. Would anybody like to second the motion?
I'll second.
I'll second.
Liquid.
Double second.
Okay, we've got a few seconds from Grace, Bill, and Brooke. We will carry a vote. You can vote verbally, all in favor, or say aye. All opposed can say nay. Let's kind of go and can you call roll just to kind of ask for vote?
Okay. This is Jonathan for the record. Bill Sims.
Aye.
Azriela Gravel.
Aye.
Grace Larkin.
Aye.
Kehlani Queen.
Aye.
And then Brooke Blanco.
Aye.
And then Ann.
Aye. Okay, perfect. So the motion passes and the bylaws are now adopted as written. Yay! A final copy of the bylaws will be posted to the Beneficiary Advisory Council webpage, and we'll make sure to share those as well.
Why aren't you guys included?
So we're not council members.
Oh,
Yeah.
Your support team.
We're support team,
Okay.
yes, yeah. So like we've talked about the discussion of the chair and vice chair, hopefully those people will lead these meetings instead of us will kind of be in the background. But of course, he'd be here to support you as needed.
Okay.
So, yeah.
And online is just Monica the support? Is there any other ones?
Monica is also support right now online.
Okay.
I mean, we're all kind of, I think these guys are also online as support as well. So we'll try to have both online and in-person support as we can.
Okay.
So, yes. Perfect. Next, we will move on to our next agenda item, and we might have to cut this a little bit short, but we did also want to have like an open forum. And for this, we have a little activity. Do you want to pull that up? So we have what is called a Menti poll. I don't know if I've done this before, but we just wanted to capture some other, I guess, priorities and things from our council members that you would like us to focus on. And so there is, there is a QR code here on the screen. If you can scan the QR code and get onto the Menti poll with your phone. Otherwise, we also have paper, a physical version as well, where you can fill this out on paper, or you can also, I guess, speak on it as well for those online. And Minden has also dropped the poll in the chat for the council members that are online. If you want to log into that, you would go to menti.com and use the code 3706-0269 as another option. But I believe that the URL or the QR code will take you straight to the poll as well.
So we're prioritizing these 8 issues?
Yes.
Or
So
concerns?
the first question is around the priorities you would like Medicaid to focus on. So we've got a couple of options. We have additions and changes to services, coordination of care, quality of services, eligibility, enrollment, and renewal processes, beneficiary and provider communications by state Medicaid agencies and Medicaid managed care entities. We started moving. Addressing equity, access, and bias in Medicaid, access to services, and then any other issues affecting Medicaid care as decided by the MAC, BAC, or state.
Oh, the poll is live.
Yes, the poll is live. Yes, sorry. And we do, like I said, have a physical paper form as well if you don't want to get on the app as well.
Yep.
Thanks, Jeff. So we'll just kind of see the poll move as people enter in their responses, or we will accept, oh, you do have it, okay. Or we will accept the paper forms as well. We did want this to be more of a discussion, but just with time, we might maybe just take a little bit of feedback if anyone wants to voice what they've put down, or if they've selected the other issues affecting Medicaid care as addressed by the MAC, BAC, or state, like what are those issues? And then we can kind of take note of those and take those back as well.
Azraella, for the record, I believe access to services should be a priority because even though we're Medicaid recipients, we don't actually have access to primary care providers, or there's specialties because there's nothing in the app network that are providing the care.
Okay.
So we could receive it, but it's just not there. So that's an issue.
Yes. Yeah. Okay. Okay.
Bill sends for the record, I would think another one should be the quality of services. Because, in today's age, you want to make sure that even though we may be on Medicaid, that we are getting the same kind of services that someone else who isn't on Medicaid but has regular insurance through an employer, that we're being treated the same as them. Because like I said, I've been on Medicaid for more than 20 years, and hasn't always been the case, so I think that would be another priority.
That the care is consistent.
Yeah.
With providers. Yeah.
Yeah, thank you for that.
Thank you. Looks like some of our top focuses, and it's still moving around, is addressing equity, access, and bias in Medicaid, access to services, and quality of services, which you kind of touched on. And so we really want to collect this feedback to kind of shape our future meetings, right? And see how we can bring either other outside organizations or maybe other units within Medicaid to kind of come and present and talk about their different programs that could really help, or initiatives that could help with addressing some of these issues. So.
Grace Larkins. I have to agree with Azraella regarding access to services, and I think there's a lot of factors in there, like we've talked about workforce, and provider reimbursement rates. But I think also this big shift of moving to like cash pay only that we keep seeing in providers, in, you know, neuro psychs and for assessments and, you know, these kinds of things, from what I'm hearing from providers or like durable medical equipment suppliers, that is really the process of working with Medicaid can be pretty onerous. And I think that the really looking at how to streamline, you know, the forms that are required, and there's a lot of sort of redundancies or forms that like specific, you know, forms and billing codes that don't make a lot of sense. I think there's a lot of kind of scrap around the edges that could be cleared out and streamlined and better, I say forms, but I mean, very literally, I think there's a 13, 14 page, you know, mobility assessment form, and that is despised by everybody that has to go, you know, complete it, and they don't even get reimbursed for the time that they put into that. And that's just one little pocket, but that I think that is just reflective of what is sort of, in a lot of different places where I think just sort of that streamlining and cleaning up would help with the access and be more incentivizing for providers too.
Administrative burden.
Yeah.
Exactly.
Yeah. Thank you. Brooke has her hand raised.
Yes, Brooke.
I figured out how to raise my hand. So, with regards to this question in particular, I know you guys said we don't have a lot of time because we're running out, but if we wanted to share some information that we thought was pertinent to whatever we selected for our answer, where could we forward that information to?
Yeah, so you can send,
with me, you know.
Yes, so we did send the Beneficiary Advisory Council orientation packet, which includes all of the BAC support staff emails. But you could also send an email over to community and provider at nvha.nv.gov, and maybe Minden can throw that in the chat one more time. You can send an email there to provide some more feedback, and we can enter that into the record. And yeah, we can take that for sure.
Okay. Perfect, thank you.
Number 3 or 2
Let's see, what is the second one? Well, let's kind of just go over it and maybe shout out a few items if they don't enter into the poll. So the second question was just, what would you like to learn more about when it comes to Medicaid? What are some topics that we can add to these agendas in the future, where we could have presenters come in and talk about, kind of like how Ann did the Medicaid 101. Is there any specific area that you're looking for, whether it's dental, thank you, Monica, and or just different benefits that we offer or cover, the managed care, statewide project, anything like that. Feel free to shout some out and we'll write them down, or you can enter it into the poll as well.
Azraella, I think having a preview of what's going to be on the agenda maybe a week prior would be suitable, so I can be prepared.
Yeah.
Okay.
Yeah.
Yes.
Yeah. Give more context. Yeah.
Yeah.
Especially if you want us to look at laws and see what's going on in legislation.
Yeah.
That would be really helpful.
Yeah. This first meeting was a little bit of it wasn't last minute. We've been preparing for this for months.
Yeah.
But it's just everything kind of snuck up on us. But we do hope to, for future meetings, send everything out much in advance so you guys can review and provide any feedback there too. Thank you.
Bill Sims for the record. Oh,
Yes, of course, Kalani. Thank you.
sorry, Bill Sims for the record. I don't know if this would be a possibility, but The one thing that I always used to have issues with before I was put on Medicare, when I was on Nevada Medicaid the first time, is that whenever I would go to a doctor and they would need to refer me out to someone else, I didn't always know if Medicaid was gonna cover that or not. Like, I did not find out until right before, like, my appointment was scheduled. Or, you know, I saw that new doctor and they're like, well, just let you know, there is a chance it may not be covered because of this kind of specialty that, like, I'm under. So you may not be covered. So, like, if we can have someone maybe come in to talk about, like,
The referrals process.
yeah, like, and how, like, maybe how doctors can be like, you know, kind of hard to explain, but essentially, like, having doctors be aware of their patients and knowing where they can direct them best, that would be covered by Medicaid, instead of just saying, I'm gonna send you over to this, like, not that way, but like this generic doctor, but I don't know anything about them. So you're kind of on your own to figure it out for sure if it'll be covered by Medicaid or not. You know, like, if they can be like, hey, here's who I know will be covered. So here's a few options for that. That, I think, would be something that if someone could come in and talk about, that would be great.
That's great. I think our care coordination is often the words that we use to describe those things. And we have a team that works on that for our fee-for-service patients within our state team. And then we also have our managed care folks that do care coordination. So maybe we could bring them in and they could talk about how they approach that and maybe get your feedback on, like, hey, it'd really be helpful to me if we did it in this way. I think that'd be really helpful. So maybe a care coordination conversation. Yeah, that's a good one.
Grace Larkins. I think that some of the ways that we feel that the federal cuts might impact Medicaid, because there obviously is going to have to be cuts. So where are those going to be coming? You know, where is that being looked at? And I think for me, the recertification, I believe it's going to be moving to twice a year as opposed to once a year. And like you were talking about, Azriela, with the welfare, it being twice a year, each one of those recertifications being a huge amount of work. I know for my family, it is, you know, honestly, it's like weeks of effort, and people think we're just doing one application or something online, but we've got stacks and stacks, and it always gets sent back no matter what you, and it's really, it feels as though we're being discouraged from even doing it or getting it. It kind of, it's like, oh, they're trying to weed out those that don't have that perseverance or the privilege of having, say, you know, that push. And so I think that that something that we can look at? Is that mandatory? Does it have to be once a year? Can we maybe get some data going first? It's like, how is that going to be? How are the changes even going to administratively look, right? I mean, who's going to be doing the checks and balances on it, and where's the staffing going to come for that, and what are it's just, I think what we may see on the horizon here and kind of what to gear up for.
Yeah. I appreciate you raising that. Absolutely. I will say that stakeholder workshop I talked about in the legislative session, Stacey Weeks did a great overview of how we're analyzing the federal bill and impacts to Medicaid. So encourage folks to take a look at that, and we'd be happy to talk more about that at an upcoming meeting. On the redetermination piece, yes, we will be held to doing it every 6 months, starting, I think it's mid next year, August 2026. And so all of those changes are things that we will be bringing here. It's absolutely crucial, whether it's redetermination or work requirements, getting additional documentation from people about those. We need to do it in a way that works for our community, and we recognize it already is really hard, right? And so I'm really excited to get feedback from you all on that. Our eligibility team that works on Medicaid processing can come and get your feedback on that as well. So that is definitely a topic that we have on the list, and we can move it even sooner in terms of giving an overview on the federal side for that November meeting. I appreciate that.
And Azraella, if you could just bring like a stakeholder from Liberty Dentist Services, so we could talk to them more about what dental services they provide through Medicaid. We see them at welfare, but we don't really want to go up to them for some reason. I don't see anybody going up to them and asking questions. So maybe if we can come here and then that will be better.
Yeah.
Yeah.
More comfortable setting.
Yeah, perfect. That's a good recommendation. Yeah.
So we did have one last question, but we are going to skip it just for sake of time, but we'll bring it to a next meeting, or a future meeting to go over. So, I'll pass it over to Erica to discuss the next following agenda items.
All right, thank you. This is Erica for the record. Next meeting is scheduled for November 10th, 2025 at 9 a.m. And we are planning to have this next meeting in the Southern Nevada region, but we are still securing the location. So we will notify everyone once we have more details for our council members. We will be putting calendar hold information into your email. That way you have the date and time. And all of our meetings, like this one, for the MAC and the BAC meetings, will be held in a hybrid format. That way everyone can participate. And the next agenda item is public comment. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. Sorry. Comments will be limited to 3 minutes per person. Each person making comment will be asked to begin by stating their name for the record and to spell their last name, including, sorry, I just skipped a line while reading, but please spell your last name for the record for us. Written comments may also be submitted via email to mschiffer@nvha.nv.gov. And if you are calling in on the phone, you can raise your hand by pressing *5. And when we call on you, we will identify you by the last 4 digits of your phone number. And if you're in the Teams app, you please raise your hand or enter your name in the comment section or chat. And again, we will have 3 minutes to speak.
Any public comment? Can we confirm if there's any public comment in the chat?
There's none.
Hi, this is Brooke speaking. I just wanted to apologize for my lack of etiquette with the whole. I didn't realize you were supposed to say your name before every time you spoke. I thought that was just like you guys, so I apologize for that.
No, Brooke, you are totally okay. This is a learning experience for all of us, and that is something that we probably should have mentioned in the beginning of the meeting, and it's more so for our note taking, and so that we can send those notes to you after this meeting. And so no need to apologize, Brooke. We are all learning all together. So,
Brooke, I'm the worst at it, so you're totally fine.
Okay, seeing no public comment at this time, I'm going to move on to our last agenda item. Thank you everyone for your participation. This meeting has been wonderful discussion and collaboration with all of you. This meeting is now adjourned. It is August 13th, 2025 at 12:02 p.m. Thank you.
Thank you. Thank you all. Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you. Take care.
Thank you.
Bye.